Here.
Okay. Mr. Warden,
Here.
Mr. Simonis, Mr. Johnson,
Here.
Mr. Hulbert,
Here.
Mr. Lumsden.
Here. Communications, Mr. Clerk, any?
Yeah, did the board get my emails concerning the rezone applications?
Yes.
Rezone
Yes.
application,
Okay. Just like I said, both Mr. Bodek and Mr. Boland reapplied for a rezone. And Mr. Boland has been working with Alex for application completeness. And if I understand correctly, Mr. Bodek wanted to turn in his reapplication before he worked with Alex for completeness. And I think they both would like to be on the next agenda.
future agenda? Okay.
Yes, sir. That's it.
Okay. Thank you. All right, open forum. Guests shall speak in an orderly fashion or limited remarks of 5 minutes or less. Mr. Warden's going to do the timer for me, if he would be so kind. The speakers shall deliver their comments and concerns in a civil tone without the use of profanity, personal attacks. The speakers shall not be interrupted except in a matter of urgency. Would anyone like to speak tonight? Yes, yes, ma'am. Yep, yeah, the mic's right there too, you can use. Okay.
Portable, right?
All right.
It is portable, right?
Yes. Yes. Yep.
Okay, my name is Donna Russin, 32 Johnson Road, Morningside Heights, Wilmington. I'm the chairperson for the residents in our community against the solar farm. Because we have concerns about flooding, what I'm going to read from is just very short, but it's from the Town of Shenango, Local Law Number 6 of year 2023. And on page 2, it mentions glare, the effect by reflections of light with intensity sufficient as determined in a commercially reasonable manner to cause annoyance, discomfort, or loss in visual performance and visibility in any material respects. It is a concern for the residents, especially the ones that are going to have this in their backyard, that there's no trees, no carbon, you're going to cut them all down instead of looking at, like, for example, when I come up Johnson Road up my Front Street in the fall, it's beautiful, the colors of the trees, I'm going to be looking at solar panels. And there's another page, page 5, and it's number 4. Solar energy equipment shall be located in a manner to minimize visual impacts and view blockage for surrounding properties and shading of property to the north while still providing adequate solar access for collectors. That's not going to be done. Page 6, number 13. All proposed commercial solar energy systems shall demonstrate that the facility will be sited so as to have the least adverse visual effect, not going to happen, on the environment and its character, cutting down all the trees, on existing vegetation, and on any nearby residential dwellings. Any glare produced by the solar array shall not impair or render unsafe the use of contiguous structures, any vehicles in the vicinity, etc. Last page, page 7, number 18. At a commercial ground-mounted solar energy system site, at least one access road and adequate parking shall be provided to assure adequate emergency and service access. They don't have an access road. They're going to use 10 Grandview Road, which has 8 homes on it, very small road. And they mentioned after all the trucks go up, taking down the trees, lumber trucks, construction, they would raise the road and get permission to raise the road. I've lived in my home 46 years, and every time the Town of Shenango repairs the road, it seems to go up higher. So what used to be flat with my land is now raised, which causes the water when it rains and we get heavy rains to come back and go to my cellar. So I don't see where this is going to help at all. Also, I know that the 2 ponds on Smith Road, this is wrapping up, 2 ponds on Smith Road, overflow, causing problems, and then they're gonna add 2 retention ponds for the solar project, which is just, we had 5 days of very heavy rain, and I don't know if it was March or April, it was in the spring. My backyard was all brown with a foot of, looked like a river going through. And so I can't even imagine what it's gonna be like if the solar farm gets approved. I would just like to mention, since I see Alex here, I didn't get a chance to talk to you ahead of time, but very quickly, my cousin Chuck Debner, have you called him back? He said he's called you 4 times. He's a planning engineer, retired, and he wants to talk to you.
I got his number one of the times that I met him, and I have to give him a call to discuss.
I would appreciate that, and so would he. And that's it. Thank you.
Thank you. Anyone else care to speak? Yes, ma'am.
You want the mic?
Yes, because I can't hear. Thank you.
I just wonder if I can ask a question. I don't know if, you know, if this meeting any of you guys answer our questions, can we do that?
It's public speaking.
It's public speaking. We don't answer. This isn't a question and answer. We hear you.
Okay.
We're
Okay.
listening to you.
My concern, and I don't know if this has something to do with what you're talking about with the solar farm, but I've run up against it before. The New York State Code, when we look up New York State Code as then compared to town code, sometimes they're different. New York State has some different rules than we do locally. But if I'm right, do I understand that the town does not have to enforce the New York State Code? That's my question. Okay, and that's what's not fair here.
Pardon?
Because
I didn't hear that last part.
that the town does not have to enforce New York State Code.
I would think. Yep, go ahead.
They
I'll
don't.
let you finish.
We've read it, and he just seconded that. And that's not right. New York State is not very well policed as it is, we know. It's kind of a mess. There's a lot of farm country still in New York State, which a lot of the rules pertain to farms, not us. But still, if there's a New York State code that has to do with solar, that works for you or helps you, it should be enforced by the local town board. Because she's got a valid complaint. We all do. We don't want to see these solar farms around here. We were afraid that Mr. Bodek was going to build that if he couldn't get the rezoning, and he might still do that. We don't need that. Quinn Estates.
Please address the board.
Yeah.
Thank you.
So-
Are you done?
I guess, yeah,
Okay.
that's all I have to say.
Okay.
Okay.
Just incidentally, for your own information, Donna was talking about NYSEG at 10 Grandview. Actually, 10 Grandview doesn't exist. It doesn't exist. If you can show me where it exists, I'll apologize. I don't think it exists. They get billed at, I believe it's 11 Heights Court. And you can look it up and tell me if I'm wrong, but that was done as a convenience for a guy named Kashu. So maybe some of you can get back with me on this at a later time. I'm not gonna word it in questions. I'm trying to find out who was on the town board when the solar farm moratorium went into effect, and how each member voted. I believe it was back in March of '23. That's what I'm looking for. I'm also trying to figure out who was on the town board and how they voted when the moratorium was lifted. Haven't been able to get that information. I don't know why, I just haven't been able to get it. So another thing I can't figure out is how a guy named Bahig, AKA Bob Kashu, would buy 69.5 acres of landlocked property back in 1995 from the Colts family. I can't figure out why he did it, but suddenly, years later, after he's been getting these breaks, these tax breaks. It's
called a 480A, private forest. And he's got certain benchmarks and things he's gotta meet to get the 80% off on his taxes. That's school and property. And he's been doing it for many, many, many years. So now, he wants to put in a solar farm, which is the exact opposite of what that plan stood for. Don't know why, but that's what he wants to do. I know why, it's the moolah. We know what it's all about. Okay, so here's the deal. He had the 480A program, he wants to do just the opposite now. Instead of honoring that agreement, he wants to put in 21 acres, I believe it is. They keep going around. They even go around about the 69.5 acres. I'm hearing it's 73, it's this and that, but 1995, it was 69.5. It's been 69.5, and it's called 42 Smith Hill Road. It's got nothing to do with anything else except Smith Hill Road, and all of a sudden, everything's Grandview, because it sounds better. And NYSEG is helping out a little in that, I believe, too. Now, I know what it's all about. Okay, so, he got the 480A deal, but now, he wants to get a solar farm, which is not welcome in the neighborhood. It seems in 2013, he bought a parcel, called 128, listen to this one, guys, this is gonna get you. Tax map number 128.01-2-6. Bought it from Mr. Hyder, who lived on Heights Court. You know what the address was? 10 Smith Hill Road. Okay, that's 10 Smith Hill. You go up Smith Hill, take a left onto Glenwood, that's 10 Smith Hill. Ties in, it would have been an entranceway to his property, that 69.5 acres. That's what it was called then, okay? And so he buys that from Mr. Hyder, and recently the same parcel, the exact same parcel, it's called 30 Grandview all of a sudden. I mean, how'd that happen? And it also was called 10 Heights Court. How'd that happen? It just seems to me people are bending over backwards to help this guy put something in that it's to the detriment of our neighborhood. There's a lot of chicanery going on here. How can you get the same parcel with 3 different addresses? You gotta go back and look. It's in the tax rolls. You can see it. Now, the counties, they gotta be aware of it, but nobody's paying attention to it. There's a lot of baloney going on here, guys. I'm telling you. The town residents and taxpayers are gonna see how this plays out, but I'm telling you, I don't know why people are, I just don't understand why you're cooperating with this guy like this, because he's only in it for the money. He could care less about our neighborhoods. It's that simple. But you guys go back and take a look at how that one parcel, 0.86 acres, it's the exact same property, 3 different addresses in different years. And most recently, 30 Grandview, which doesn't exist. There was no 30 Grandview, but it ties in with the NYSEG substation, you see?
Sir, your time is up.
That's fine.
Okay.
Just please do, look
All,
that up.
all records are available in the town clerk's office.
I know they are.
Okay. Anyone else care to speak? All right, hearing none, we're gonna move on with our agenda. 5.1, comprehensive plan recommendations. Comments? Discussion?
We had the interviews. We got the letter from Alex on that. That's provided the support for the 3 firms that we interviewed. So where I remember we left it was to have the conversation about where we're gonna rank them and do the award on them. So that's what I was prepared to
Yep.
have today, so.
I've wrote down what my choices were. I don't know what you gentlemen did or how you wanna go about it.
Well, we can get into details if we need to, but I can tell you where mine ranked. Were Collier's Engineering 1, Labella Associates 2, and Fisher Associates 3.
That's exactly what I wrote on my sheet. That's what
Yes.
I had.
That's what I had on mine.
That's what I got.
That's what I,
Jay, you weren't there,
no,
right?
no, so,
That's what I had. I thought the first group did an outstanding job.
excellent.
Huh?
Makes the head
Well, so,
Um,
we're in favor of that, gentlemen?
Well, I would make a motion to, have Nate and Alex coordinate an actual proposal, an agreement with them in accordance with the received RFP. And, get that onto our agenda for the next meeting so we can stay on track with awarding that.
I would second that. Any discussion, gentlemen?
Just quick, Alex, when does the timeline call for the contract to be
You need your,
finalized?
I can't.
Ken,
There you go.
when did it say? I just wanna, 2 weeks might not be, it could be enough time, but I'm out of town next week.
I think we were the second week, or second meeting in October, but I
Yeah,
think I
that-
had the
The
15th.
15th is what it was, so that is 2 weeks.
Correct.
4
Three.
weeks.
3, yep.
Yeah. So,
Okay,
Excuse me.
and that'll give us time for a back and forth with them also if we need one.
so we can have the resolution drafted for the discussion and then at the next meeting and then prepare everything for the final meeting? I mean, just as an update?
Yeah, we'll definitely be able to give an update. I mean, a draft resolution, there'll be a draft of the contract probably by the next meeting. But I can't guarantee it'll be final. So, but we're on track otherwise, even if it's still draft as of the next meeting.
Okay. Was there a contract, Alex, format as far as E EJCDC or AIA that was in the RFP?
Checking real quick. I don't recall it on this one. I know we had a specific format in a prior one. I think we left this one to, because some of the consultants might not have been EJ, might not have been engineers. They might have been planners.
Okay.
I don't recall an EJ CDC stipulation.
I don't recall a form being specified. I would look
No.
to the proposer to give us their draft agreement and we'll mark it up.
Okay.
And we were, October 15th is estimated final plan scope and contract negotiations completed. October 29th, we anticipate awarding the contract. So we looked at award at the end of next month.
I want to check that. That seems to be,
I think it was the vestibule that we had the contract format, not this one. I don't see a contract format here.
So I would just suggest that the motion be to, authorize us to enter negotiations with the indicated proposer to work on getting a contract together to present to you. Without necessarily the due date of next meeting.
Can amend your motion, Gene?
what was the motion for, next meeting, or was it for the 15th, or was that the 15th that was came out in discussion?
15th came out.
Discussion.
15th came out in discussion.
Okay. Then I would amend my motion to have the draft agreement and resolution ready for our 15th meeting.
I'll amend my second. Any other discussion, gentlemen?
None.
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 Okay. All right, we're gonna move on. Pardon?
Somebody gonna reach out to the 3 firms and let them know? Okay,
He's been in contact.
This is Alex. I'll do that.
okay.
We got a vote.
Pardon? Oh, thank you. Mr. Clerk, roll call, please. Thank you, Kevin.
Mr. Warden?
Aye.
Mr. Simonis?
Aye.
Mr. Johnson?
Aye.
Mr. Hulbert?
Aye.
Mr. Lumsden?
Aye. All right, we're gonna move on to 5.2 wastewater treatment plant updates. Mr. Gregory.
All you see here are the pay apps for the contractors.
From Bartlett Judas.
Bartlett Judas, yes.
Yep, any questions, gentlemen?
No.
I have none.
I have none.
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 Okay, well, there's no public hearing. We're gonna move on to number 7, new business. Mr. Chuck Campbell, would you come up here? You're up, sir. Blue Cross Blue Shield presentation. If you would grab that mic right there.
All right, guys.
Hi.
I'm gonna handle these packets real quick. Anybody who's a board member that would like a packet, just let me know. I know Gene has seen me around. Mike, I've seen you many
Yeah.
times. Anybody else, just hold your hand up, I'll give you a packet. I got 7, I may be a little short.
I'm good.
No,
Got
this
one
is the
now.
same, no, if it's the same information we got in our agenda,
Is it all the information
I
in
don't
here?
know if you got all that.
oh,
You
then,
don't have it all.
okay, then,
Might be something there.
okay.
All right. Thank you, guys.
Thank you.
If you got one, I'll take one. Thank you.
Chuck?
Have a cup?
All right, guys, my name is Chuck Campbell. I help the town with their health insurance and other human resource things. I don't know a lot of you, so I'm sorry about that. I know Gene from over the years, and I know Mike, know a few of you. I'm with the Finger Lakes Group, and the reason I'm here tonight is because I was speaking with the office. They wanted me to come in and talk to you about a couple of things, including the health insurance and the budget for next year. Okay? If you have any questions, please feel free to just yell out. I'll answer anything I can for you. All right. Now, are any of us aware of the health insurance here and how it works? It's Excelis Blue Cross Blue Shield. Okay. We have a plan here called the Bronze 4. All that means is there's 4 levels of health insurance. There's a platinum, gold, silver, and bronze. We have a Bronze 4 with a deductible. And what we're currently doing is we're self-funding the deductible for the employees because it saves the town money. In doing that, the prices, the premium for that program is going up 11% for 2026. I know Gene mentioned something that they got from the office. That should have been in that thing you received, the email from the office. 11% was the actual increase, okay? Now, if you pull out this piece of paper on the right side of your folder, it's an explanation of 3 different health insurance programs. The first one is your Bronze 4, okay? It describes it line by line, the different procedures you would encounter in healthcare and the cost to the employee for each one of those, okay? Then there's a middle program. Middle program is Bronze 7. And the last program is a Platinum plan. Okay? All right. All right. What I've done, I just gave you a Platinum plan because when you self-fund health insurance, like you guys do, it actually makes your plan a Platinum level plan for the employees. So on the sheet just behind the Excelis paperwork is this one. Okay. I just scribbled some notes down here. I wanted you to see your healthcare expenses and how they can be less going forward. The standard Platinum you can see for 2025 would have cost the town $571,783. Okay? The Bronze 4 cost the town $428,000. So you saved in 2025. Now, these are projections because 2025 is not yet done. But we use some of the figures from 2024, and we've projected or extrapolated out the remainder of the year. The approximate reimbursement for this year will be about the same as last year. It was 55,000. Let me see here. Where is it? It was $55,451. That was the amount the town, through an HRA, which is a health reimbursement account, sent to the employees for expenses they incurred in healthcare, covering their deductible expenses. It was $55,451. You also have an HSA program, which is a health savings account. The health savings account, for the year, the town puts in $63,000 into all the employees' HSA accounts. So those are your two expenses, the HRA and the HSA, in addition to the premium for the Bronze 4. All those costs combined were $428,603. Okay. So that's where your savings come up. Of course, that's, like I said, an estimate, but it's pretty close. Now, we're going forward for 2026, and I want you to see the standard platinum plan. As it went up, like every plan is going to for 2026, if you had the standard platinum for next year, it's $649,624 would be the cost to the town. If you have the same number of singles, same number of families on there, that's what the cost would be. Okay, the Bronze 4 going forward to next year. If you left the plan with Bronze 4, the plan would be $466,000 next year. So you'll see it'd be about almost $40,000 more next year. Okay? Now that's using the same figures for HRA contributions and HSA contributions. Okay. For this past 2 years, they've been about the same, so I use those same figures for a projection for next year. Now, I put in this one, and under 2026, I put the Bronze 7 in there, because Bronze 7 is a newer plan they've come up with, and it's structured very much like the Bronze 4. If you look at this Excelis thing, and by the way, if you have trouble falling asleep at night, read this, it'll put you right out. Okay? This thing has an expense on here. It shows about how 100% is covered by the health insurance, but some of it is subject to the deductible. You like the plans that say 100% because they're very, very much easier to self-fund and keep track of how much money goes to the premium and how much goes to the insureds, the employees. Now, the Bronze 7 is structured very much like I said, like your Bronze 4. But the pricing for the Bronze 7 is almost identical in 2026 to your pricing, the Bronze 4, in 2025.
And why is that?
Because the deductible is larger. Now, if we open this Excelis packet, again, this piece of paper we had you pull out first, go to page 2 and I'll show you the difference, the main difference. Now, on this page 2, you're gonna see there's 6 columns there. Where I'd like us to focus on are the first column for each plan. If you see the Bronze 4 at the top, there's 2 columns there. Let's focus on the first column, okay? If we look at the Bronze 7, focus on the first column there. And the same with the standard platinum, use the first column. Because we're gonna compare apples to apples. The second column is for out-of-network expenses. They don't really apply here that much because all the hospitals are in network. It's a Blue Cross Blue Shield network. It's the biggest and best network you can get for health insurance. So if we look at the first column for each of those plans, near the top, I believe it's the fourth box down, you see deductible. Your current bronze 4 is going with a deductible for a single of $8,500. The family is $17,000. All they do is double the individual deductible for the two-person and family deductible. You can see that $17,000 is twice of $8,500. If we look at the bronze 7, which is what I'm showing you here, the individual deductible is $10,600, so it's $2,100 more in a calendar year. Of course, double that is $21,200 for the family. Okay. So you see the deductible going up, and that's why you'd be able to get this plan next year for the same price as you're getting the bronze 4 this year. You have to expand your deductible. Now, again, what I want to let you know is, like I said, your expenses for reimbursement this year, reimbursing the employees for their medical expenses through your HRA, was $55,451. Now, on the last sheet, the reason I mentioned this is because on the last sheet that's here, I put this together, it shows your exposure on deductible for a calendar year. In the bronze 4, your exposure would be $289,000 total. That's your total deductible you could expense out in a calendar year by reimbursing people. Now, you'll never go that high. You only expensed out $55,000 this year, $55,000 last year. You've never gone really higher than that. Okay, so when we look at this, I will tell you how it works too with HRA and HSA. It's called stacking. Whenever people have HSA money, which you provide to them, by the rules in New York State, they have to use up that money first before you can begin to reimburse them with the HRA for the remainder of the deductible. So their money has to get spent first. That's just a rule, and we stick by that rule. So when you look at this, the bronze 7 shows you a total deductible expense you could incur of $360,000. We call that your exposure. Does anybody have any questions on that? If you do, it's fine. I'll tell you, with this, you're gonna probably next year, you may incur, because your deductible could be a little higher with a bronze 7, you could incur some more expense. When you have a set group of individuals in the workplace of your size, you may get, I don't know, usually 3 or 4 that, on average, that would use a whole deductible, on average. The remainder will use some. Maybe they go in for emergency room and but again, they're having to spend their HSA money first. So some people don't use any HRA money at all. Can you follow me on that? Okay. So if we look at the bronze 7, your exposure is greater. It's, $71,000 more you could incur. I can tell you now that you're not going to incur that entire amount, not even close. Again, $55,000 has been about the average for you guys for several years. Okay. The reason I mention this is because I would encourage you, if we're looking to save money, and a lot of my groups are going to do this, is switch to the bronze 7 for next year. Okay. That keeps your premium almost identical to what it was this year. It's less than a 1% increase. It's about 0.25%, something like that, increase, which is negligible. But when you have these sheets here, the reason I gave you these is so you could go through and take your time and look at each procedure and compare it line for line. Again, remember the first line under the plan is in network. You can write on these, are yours. You put in network there in that first column. The second column on those plans is out of network, so it doesn't really apply. I'm not allowed to cross it out because it's a Excellus pamphlet brochure, but you can cross it out. The first column is the one that you really want to look at, okay? All right, if you guys have any questions on any of this stuff so far, again, here's where you compare the plans. Here's your different cost bases for the year, okay, on each plan for 2026, 2025. Here is the exposure for each plan, okay? Again, you don't see any exposure, you don't see the platinum plan on here because it doesn't have a deductible. There's no deductible for it at all, okay? All right, any questions so far, guys?
When do
Chuck,
we have
I've
to
got
have a
some.
decision made?
Now, I gotta apologize, if you could speak into the microphone, I have trouble hearing sometimes, sorry, Gene.
No, there, between the two plans, the Bronze 4 and the Bronze 7, on the first page of this, the plan type is deductible HSA for the Bronze 4, and deductible and HSA eligibility is no. So what happens to our policy or that switching, if we switch, how does that change affect the HSA?
And that's what I was gonna get to. A good question, because I was coming up with that next.
All right.
It's a good question, that's
Then-
right.
Then the two other questions that I've got is, one is, when do we have to make the decision on selecting this, which plan we're gonna move to?
I'm sorry, Gene, I didn't hear you.
When do we have to make the decision and authorize it for the
Okay.
selection of the plan?
Yeah, when do you have to make the decision? The sooner the better, to be honest. I mean, what has to happen is, we have to submit this, because you have an HRA that is administered by Excelis. We have to get the paperwork into them, which plan you have. We're supposed to get it into them really by the first part of November,
Okay,
okay? Now, again, is it a hard and fast rule? I know you guys have to get together and discuss this stuff, so it takes some time. But, we'll get the paperwork in and get it working. But anyways, Gene brought up that if you look on the first page, HSA eligible for Bronze 7 is no. Okay? And that was one of the things I was gonna bring up and that we're gonna talk about on ways to save money. There are a couple things here I brought with me. Again, how long do you want me to, Mike, to go? I've only been up here about 10, 15 minutes now, but I don't wanna go too long. I could be here for 3 hours. I don't wanna be too long.
No.
no,
I'll try and do it in
but
20,
just give,
20 more minutes. Okay,
yeah, just to go over the highlights of how that's gonna be with the HSA.
sure.
Yep.
One of the things that we do, we've done with some other places, it really isn't a good scenario, but it's the best they've got. With the HSA program and some of other groups that we have as well, they've had to drop their HSA portion and just take the deductible and fully fund it with an HRA. The health reimbursement, the difference, guys, the difference between HRA and HSA, HRAs, you give an employee money when they incur expenses, only when they incur expenses. With the HSA, the health savings account, you give them the money up front. Even if they don't have any expenses, you're still giving them the money. They put it in their account and it sits in there and grows. If they don't have any medical expenses throughout the year, they get to keep that money. And that's a very good program. It's very gratuitous. It's great for the employees, they love it. Because in an HSA program, there's also mutual funds. They can leave that money sitting there, it grows in mutual funds, just like a 401k. Now, I'm not allowed to say it's just like a 401k, but it has mutual funds, the same mutual funds 401ks do. They can use it for a retirement plan, because whatever money's left in there, when they retire, they keep it. That's the law. And when they turn 65, they retire, they can draw that money out just like a 401k. It's taxable to them, but they draw it out like a retirement plan. So in essence, you're giving them almost a retirement plan with the HSA program, people that aren't spending it. Some people expend it every year, most people do not. So they have money left over, okay? I say most people, we're not allowed to ask them about their HSA accounts. By law, we can't ask them how much is in there, how much have you saved, how much have you spent, we can't do it. So once you give them the money, we don't see it anymore, they do. Okay? So when I talk about that with this program, to get to 7, you have to convert the HSA portion of the reimbursement to HRA.
The
And what-
existing monies, convert them, or just in the process, what future monies go into an HRA?
That's a good question. Does existing money, the money previously given to them, does that convert? That money stays in their account, they keep it. It's only future monies that you would convert to a health reimbursement account,
And
HRA.
how much is the town putting into the HSAs?
Right now, annually, they're putting in 63,000. That's 2,100 for every single, and 4,200 for every 2-person or family. If you add them up, it comes to 63,000 in a year.
Okay.
Okay.
And will, the only two other questions that I've got is, are there any changes in the Bronze 4 plan that we currently have from 25 to 26?
I'm sorry, anything in the Bronze 4 plan that,
That changes?
oh, the deductible did go up, $200 for an individual and $400 for a family. It was just to be 8,300, now it's 8,500,
Okay.
okay? So it did go up.
That's the only change?
That's the thing that you look at, that, yeah, there's nothing else that's significant at all. I can look in here. Hold on. No. I didn't notice anything else, to be honest with you. Everything else, if you see, it's covered 100%. Everything is covered 100% sub to the deductible. The only thing that they don't have to pay deductible on are the preventive maintenance drugs. Preventive maintenance things, x-rays, or I'm sorry, physicals, things like that are preventive maintenance. They get that for free. Insurance covers that.
So in the Bronze 7, not on the last page, but second to last page, the acupuncture, the adult routine vision, and the adult eyewear have gone from 100% covered with respect, after the deductible, to not covered at all.
Okay, hold on, let me just see. Where you at, acupuncture?
Yes, under acupuncture, and then under the vision benefits, there's 2.
Not covered.
They switched from 100% to not covered.
Let me look.
Second to last page, all the way to the right.
The last page.
Second to last.
Second to last.
You're on it.
Okay.
Those are the 3.
Acupuncture, okay. Okay, covered 100%.
Well,
Okay.
same thing is true with the adult eyewear, right?
Yeah,
Oh, I didn't hear, okay, sorry.
yeah. So are those the only 3? Are those the only 3 changes between the plans, except for the deductible?
Well, you mean is the coverage is 100% for acupuncture? Is that what you're talking about in chiropractic?
It is under Bronze 4, but if we switch to the Bronze 7,
not
then
covered.
the employees lose that coverage.
Right, right. Acupuncture not covered, yeah. And the chiropractic 100%, yeah.
So is there a way for us to understand how many employees utilize those benefits?
Oh, no. That's a great question, though. If you could, it would help decision-making so much, wouldn't it? But we can't ask them anything about their health care. We can't ask employees
Under
what
the
they're
HIPAA
doing.
rules.
We could, if they volunteer the information, sure, but we can't ask them. It's against the law to ask them.
I didn't know if there was a metric that was out there that,
Oh, how many people are using it, you mean?
yeah.
Okay, I
that-
get what you're saying.
Yeah,
I mean, is there,
not a name, not social security number, not how much they pay, that isn't
are there
that.
statistics that show how many people use acupuncture, that kind of thing?
Yeah,
Yeah, there could be. To be honest, I don't really know them. I gotta be honest. I don't know the acupuncture statistics. I don't know how many people use it. I know it's gotta be, somewhere probably in the 1-2% range. I'm speculating. But, yeah, I'm sorry I don't know that figure for you.
okay, I'm all set.
Okay.
Thank you.
You're welcome. Yeah. Again, I know it's a big step to drop the HSA, make an HRA. The employees, obviously will, wish that didn't happen. But when I talk about ways to save money going to next year, it's a big way to save money for the town. We put the HRAs back in years ago when you guys still had, platinum plans here. And we could put it in because even with the HSA and the HRA, you were still saving, I think probably $200,000 a year. Okay, and now that is, to me, unjustifiably, the rates increase so much every year, it's ridiculous. And now that they increase every year, it gets harder and harder to supply health insurance to the employees. It's the second biggest expense for employers across the nation behind payroll.
Exactly.
So, I do know that. But, yeah, so it's tough. So I just bring that in because one of the ways to save is to go to the Bronze 7, and along with that, you'd have to drop the HSA. And they wouldn't have to pay any more money out of pocket. The HRA could cover the remainder of the deductible, so they'd still have a great platinum plan. I just let you know that's one of the ways. It's something you guys do, and sometimes towns and villages do it. The majority of them are now doing just HRA, so the employee still has next to no out-of-pocket expense, usually nothing, and it still covers, so it gives them great coverage. They're just not getting free money for their retirement anymore. And again, it's up to you guys. Either way, I'm fine with it, but if you want no ways to save money, that's a good one. That's 63,000 right off the top. Okay, now that will, obviously your HRA money will increase a little bit because right now, when people don't use their HSA money up, if they don't use it up, they don't get any HRA money. But in the case where they wouldn't have any HSA money, you'd be using HRA funding them for their deductible from $1. And before, they were using HSA money for that. So your expenses for reimbursement would go up slightly. But it would overall, I'm sure, save you money, considerable amount. Again, we're not allowed to ask who spends it, who doesn't spend it, can't know that.
When is the deadline for making this change?
Well, again, the biggest stickler here is that we have to submit, because you use Blue Cross Blue Shield to administer the plan for reimbursing, they'd like the forms in 60 days before the beginning of the year. Now, if we send it in November 15th, are they gonna take it? Sure. It's just sometimes if we get it in too late, they don't have it in their computer system by January 1st. So it becomes a problem at that point.
Can the town have some employees with an HSA and then some employees without? And the reason I ask that is because we're required to negotiate this with the highway union. It's a matter of contract with them. They're contractually entitled to the HSA. We can't just unilaterally take it away from them. Town hall employees are a different matter, that's up to your discretion, but we'd have to resolve an MOA with the highway union about modifying this. Typically, in my experience, they ask for more money in their salary as a result of that.
And that is a big sticking point when there's a union involved. That's right. That's a change.
Well, Can there be different tiers of insurance? Can we do 4 and 7, or do we have to do one or the other?
You can have more than one plan, absolutely. And we can have a second plan in here. If you wanted to do the 7 for some employees. Now, the only way, if you say to your employees that you have to take this one, and these guys over here take this one, then you can discriminate in New York State based on level of employment only. Level of employment means, key people or managers, and you could have salaried employees and then laborers or hourly employees. So you can discriminate on levels of employment only. So you'd have to have something in writing, tucked away somewhere in the office, So if you get audited, it's there. And you can do it, though. You could say, okay, these guys get the bronze 4, these guys get the bronze 7. It is legal to do that, but you have to label those employees a certain level.
So we should be okay then, Gene, because the highway contract actually specifies the Simply Blue plus Bronze 4 health plan. So even if we move to a different plan that had an HSA, if it's not the Simply plus Bronze 4 plan, we have to negotiate that as well.
Okay.
So any change to the health insurance plan, if it's a different plan, we'd have to negotiate it.
Okay.
Okay.
Any other questions, gentlemen? David? You good?
I'm all set. Thank you, Chuck.
Okay.
Thank you, Chuck.
Oh, you're
Thank you.
welcome. Now, I'm not quite done.
Oh.
Sorry, I gotta bore you just a few more minutes if it's okay.
Go ahead.
That's the health insurance. I wanna get that out of the way, because the pricing just came out on Monday. So I wanna give you guys as much time to hatch it out and do what you have to do with it. So it just came out Monday, and I was able to bring them today, so I'm fortunate that way. Okay, real quick. I'll just do 5 minutes on each, so you can, I won't be much longer. Okay, if we go to the left side of the packet, these two pieces of paper, I left them separated, not attached, so you could do this with them,
Yeah,
like this, and hold them together like this. Okay?
yeah.
Read- okay. Hold them together, and what you'll see there is 5, if you look across the top, you see 5 prices across the top. This is Medicare Advantage, which you supply to your retirees. Okay? There's 5 plans, you'll see there's, across the top, it says monthly premium, 0, 0, 22, 3150, and 84. Now, this is this year's pricing. I'm not allowed to show you next year until after October 1st. But it's going to be very, very close to the same. In fact, the $84 plan, which you have now for your retirees, used to be $86, actually went down $2 at the end year end. So that's the prices for the plans. You currently have the one on the far right, the Medicare Blue Enhanced, okay? The reason I'm showing it to you is because you do have options in that these are 5 direct plans through Excelis. The very first plan, the Medicare Blue Active, is the very first one. That is probably the most popular plan that's out there now. You're gonna, if you look across the page, and when you have this, you guys will see there's things, primary care physician visits, specialist visits, laboratory services. You'll see different procedures here, and the cost for each one is there. Again, the same applies to here. There's 2 columns under each plan. You use the first column, the IN column. OON stands for out of network. And all the hospitals obviously are in network around here, and almost all the doctors. So I show you this because it is something that we could look at doing for January 1st. We can make a change, and a lot of companies are going with the Medicare Blue Active. I'll tell you why, because also you guys not only pay the premium for this plan for the employees, you also pay for their Part B, which is the government cost for having Part B for Medicare. You do both. That first plan costs 0 premium. So the $84 per month for every employee, or every retired employee, goes away. Also, on that first plan, you'll see it right under the 0. It says with a $48 Part B refund. What happens is all the employees that you have retired that have this plan would also be paying $50 less for their Part B for the Medicare. Which means since you guys pay it for them, you would be paying $50 less for each of the employees every month. In addition to the 84. Okay, there's 4, I say 50, it's 48. So, you add those together, it's against $132 a month you'd save for every retiree in buying the Blue Active, the very first plan. Okay? I show you that because it's very attractive. It's not a bad plan. There's things you can do if you want to, you don't have to. You can say, okay, if we want to go to the Medicare Blue Active, you could self-fund hospital expenses for them if they go in the hospital. Those kinds of things. You'll see here inpatient hospital care right in the middle, $400 a day, only for the first 5 days. After that, it's 100% covered. So their maximum cost going to the hospital like that would be $2,000. Okay. You also have, there's other things, there's surgical benefits, they're all here. You can see them: ambulance, urgent care, emergency room, outpatient hospital, different things here. All those costs in the first column will tend to be more than where you currently are in the last column. One of the things, look at primary care physician. You guys you're currently letting people pay $0 at the doctor. Going to the Medicare Blue Active, it costs them $5 to see their doctor, that's it. So it's not like you're raking them over the coals to change this.
No, but it's a $38.50 annual exposure to them.
Well, there is an exposure, yes. Let me just say this. We all look at the exposure and we say, that's a big number. It's true. They have a big exposure, 5,000, in your current plan. Nobody ever reaches it. It's almost impossible. It's not impossible, but almost impossible for them to reach it. The fraction is so small, it's so infinitesimally small that they would be able to expense that, because you see everything is just a copay. Insurance covers the rest. Okay? When you get into that higher cost, it's generally when somebody has to have a special drug that gets mixed by the doctor, and it can be expensive for some unusual thing that would happen. We insure over 400 people with Medicare, and we've never had anybody ever reach the maximum. We've had them insured for, a long time, 15 years, 20 years. No one's ever hit the maximum, and I see it's there, and it's a good point to bring it up. It's more, that's right, than your current plan. But for them to reach it is it's not impossible, but it's almost impossible. So,
And the deductible for prescriptions is in addition to that.
let me look here, hold on. Okay, let me see here.
Yeah, it's part B.
We're looking at the Medicare Blue Active plan?
Yes.
Okay. You'll see a pharmacy plan there. You'll see there's always 5 tiers in this plan. You'll see percentages there. When you look at this, you'll say, okay, it's 0, 12, 42, 45%, and 28%. I apologize. Who asked that question?
I
Okay,
did.
I didn't see it. When you look at the program, it's a percentage. Otherwise, it's covered. When you look at this, 0 and 12 are the 2 generic. There's standard generic and then a preferred generic. Then you get into the standard drugs, and then you get into non-standard drugs with the 45 and 28%. Okay, those are drugs that are very expensive. And they do, obviously.
I just went to the bottom line here. All of those lines going across, when I compare the Medicare Blue Enhanced to the Medicare Blue Active,
Yes.
they are very similar. The exception that jumped out to me was the deductible for tiers 3 and 5.
Yeah, now, tiers 3 and 5, the $350 deductible is for those 3 through 5. That's with the $42 copay, the 45% and 28%. That's where that's applicable. That's correct.
That's where, oh, okay.
Yeah.
Understood.
It's applicable to those last 3 tiers. So if they're getting generics, there's no deductible. A lot of your people, and again, I don't know, Jay, how many, and we can't know, but the majority of your people, I'm gonna say 90% of them to more than that, are all getting maintenance drugs, high blood pressure, cholesterol, that kind of thing, and they're on maintenance things that are generic. And that's just what happens when they've been there for a while. Yeah, you can see, unfortunately, if you look at your plan that you currently have, it does, you'll see, I think it's ridiculous, 50%, 33% on the last two tiers, and 42, which is almost, you know, it's not as good as the plan, the Blue Active. There's no deductible, but the percentages are higher. Did you see that?
Right.
Yeah,
Right, yeah.
so they get you coming and going, you know what I mean? They set it up so that you're gonna lose one way or the other. And, so that's fortunate, but, anyways, that's one way to try to save money. I want you guys to be aware, a lot of our clients are doing that, as we look at next year. And the last thing I'll throw up to you is this. It's on the left-hand side. It says Safe Harbor. Okay? All this is a voluntary program that companies are offering now. There are already towns and villages, municipalities already doing this, here in central New York. This is a program that you can say, it's voluntary. If you want to be in it, you can, but you don't have to be. Employees can get in it. When they're in this program, it's set up in a way that they all get the main, and here's everything that's in the program. This, page by page, it's one thing at a time here. You're free. The first couple things you're gonna find is by being in this program, it actually, the bottom line, costs them nothing to be in the program. Okay? The town actually makes money by having the program. The tax breaks that are in this program will end up saving the town between $500 and $600 in payroll tax on every employee you have that signs up. You actually make money by having the program. On the second page of this, you see, so let's see here. Let me see here. Mike and Ryan are the guys that created this. They're in Massachusetts. The program is so good with the tax breaks and the benefits offered. Mike got CEO of the Year. Okay, CEO of the Year, and Ryan got an Outstanding Leadership Award for the program. So it's a very good program. It gives people, the employees that sign up, it gives them unlimited mental health visits without even a copay, no cost at all. They can have as many as they want. They do it at home, over their computer, over their phone. That includes the kids, the parents, everybody. Unlimited mental health visits. That's huge in this day and age. I wish every kid could have this. And you get paid to have it. You actually get tax breaks where you make money by having the program. Also on here, which could save you money in reimbursement on your health insurance program, they also get unlimited doctor visits for free with no copay. That's over, it's telemed. It's over your computer, over your phone. All a mother has to do when she gets home, if the kids are sick, is call the 800 number. A doctor will call back and diagnose them right over the phone normally. If they need a prescription, he'll call the prescription. He or she will call the prescription for the patient, for the child, the parent, and at their local pharmacy. But the visits, the psychology visits, the mental health visits, and the doctor visits are all absolutely free, not even a copay. How many of your employees would be using this and then not using your health insurance? It wouldn't have to get reimbursed then. You guys get paid to have the program.
Chuck, when you say
Two
we
tax
get,
breaks.
right here, when you say we get paid, describe that a little further to me.
Sure. This is how it works. It costs the town or any employer $35 a month per employee in the program. It comes out to $420 a year as the expense for the employer to have that person in that program. Because when they're in the program, they get special tax breaks, the employees and the town. They're put certain numbers in the payroll. It's in your payroll program. It calculates it automatically. You find your payroll taxes will go down every quarter. And they go down significantly because there's two things involved with the program. There's Section 125 and 105B is the IRS section for wellness programs. And you'll get it in their payroll, it will be set up so that deductions are already made. The employee actually will make more money in their take-home pay by being in the program. You guys will save generally over $800 for every individual in the program in payroll tax. But I subtract out the $420 that you have to pay. So that's why I say between $500 and $600. I've already subtracted out your expense. You'll also save about $1,200 or more on every family that's in here, in this program, and payroll taxes. You subtract out the $420, comes out to about $800, and give or take, depending on the person's tax status and their deductions. It varies. But on average, you'll save between,
So for the town, it's payroll tax,
it's payroll tax for the town. Yep.
and the employee would be state tax, federal?
It'd be their federal and state taxes, that's correct. They get breaks in. Now, I'll tell you this,
Reimbursed or just a deductible? It's deductible.
deductible?
Yes, when you're saying reimbursement, is it just deductible off their tax, or are they actually gonna get a check
Well, let
to
me-
reimburse them for their taxes?
Well, let me be clear on that, I apologize, let me be clear. There are no reimbursements here, okay? Let me be clear on that. No reimbursement, if I said that, I apologize, I
Well, you,
misspoke.
when you said get paid, it threw me off.
Oh, okay, all right. I say that because you're gonna make money on the program. Nobody gives you a check, but what they do actually is make you pay less. So you get a tax break. There are towns and villages that are here right up by 81, all up and down through here that are on the program already, saving money. And it's a great way to save money. You give employees good benefits. They get better benefits, and because if you go to the HRA, you're gonna find people are spending less money going to the doctor, because when they get home, they'll just make that phone call. Because we stress that with these guys, because it's all free. They don't even pay a copay. They go. Mothers don't have to go home, go to the walk-in clinic for 2 hours, get back. They can sit home, get diagnosed right over the phone or the computer, prescription gets called in. It's easy. And you get paid, I say get paid. I mean, I
I
should think of a
understand.
better way to say
I
that, right?
understand.
Because I'm not handing
I
out
just-
checks,
I
I'm not
just
handing out
wanted to be
checks as you
clear.
walk by. Okay. But it's a thing where, the tax breaks are, you don't even have to fill out paperwork for them, because if we put it in the payroll program, it's automatic. Yeah, it calculates it for you guys, and you just see it, at the quarterly payroll, you'll see it's reduced considerably.
I appreciate the clarification.
No problem, yep. So, okay, that is the Safe Harbor Wellness Program. And, yeah, they're already, and we just show you this stuff because it's money saving and it helps the employees. Now, and your budget time is coming up, so I want to get it to you early, in case you want to factor that in some way.
Does that have a certain enrollment time too, or can you do it any time during the year?
That's a good question. You can do it any month you want. You don't have to do it January 1st. You could do it next month, you could do it next year, doesn't matter, when you want to, yep. And when you enroll these people, I tell you, it's a voluntary program, so you aren't forcing people, so you don't get pushback on it, and you're just gonna save money on everybody that enrolls. It's a good way to save money.
And it makes no difference what plan we select.
No, the health insurance, they have to have health insurance to be in the program, but it doesn't matter if they're insured here or with their spouse. It's a great question.
Or whether it's bronze 4 or
Yeah,
bronze 7, doesn't
Yeah.
matter.
Doesn't matter. As
How
long as
about towards the retirees? Can they
Retire-
enroll in as well with that?
and that's unfortunately, I have to say no. It has to be employees that are currently employed and still employed. Okay? If you're collecting a check, you're supposed to be somebody working at least 20 hours. So, and that's that, guys. I tried to hustle as quick as I could. I apologize
No.
for taking so long, but anything else, any more questions anybody has for anything?
None.
Good, thanks, John.
Thank you. Guys, thanks for your time. Yep.
Thank you.
If you need to get a hold of me for anything, oh, is that on still? Yeah, Mike has my number if you guys can call me.
Yep.
Also, in your package, you'll see my phone number's right in there. You can text me, call me, any questions you have.
What did Gene just say?
I think he said it'd be right now. You can continue to continue.
Okay. All right, we're gonna move on to 7.2, monthly abstract discussion. Jody sent out everyone's concerns with that sheet. Did everyone get that?
Yes.
Discussion. Or you wanna wait for Gene, or? Legal.
Guess I do want to have the discussion with Gene here
Okay,
to understand why it needs to be once a month, or
Yep.
whether or not we can do it
We'll wait
prior
for
to
him to
each
come back.
meeting.
we'll take
Because
a
I know
minute.
that's an issue for him.
You all right with that, Mr. Dave?
Yes.
Okay, we'll chill out for a minute. Thanks, Chuck. Have a safe trip home. He got his key to get back in? Oh, maybe it comes this way. Mr. J, you have a question for Mr. Jean.
So Gene, it's regarding the abstract discussion. We had discussion about doing these once a month, to have them once a month. And Mike had asked if everyone had seen the email that Jody had provided regarding concerns from each department. You did, okay.
This afternoon, I
Maybe it was
or
just this
maybe this
afternoon.
morning. I wasn't in the office today, so I'm
Just before the meeting.
just before the meeting.
I didn't
Yeah,
s-
it was 3:20 this afternoon, yes, is when it came out. The departments have all obviously had some concerns about that. And I was just raising it because we had discussed it at a previous meeting about having all of those once a month prior to a meeting. So with the concerns that I read, and I realize you haven't gone through them yet, do you believe that maybe there's an opportunity to do this twice a month? That we would have these before the meeting? You know, kind of how they're doing them now. The difference is that we would have them days prior to the meeting to be able to approve them. I'm just trying to understand kind of logistics of going through this, and even doing it once a month, it would reduce the volume to us as well.
My biggest concern is, that we're not looking at the invoices. So, the amount of time proper. We just have not, in 18 years that we've done it, we've only done it once a month for the last 3 or 4 years. And it hasn't, or we've been doing it, every meeting for the last few years. Cash flow doesn't work that way, invoicing doesn't work that way in any other world except here. And so I don't, it's not that I did or didn't support it before, but it's just, it's a cluster kind of activity. So I don't, personally, it's not an issue to me so much about the frequency. But if we're coming down, if we have to make the effort to come down twice to look at these, or if they're electronic, that's a bigger issue that's a bigger way for me to be able to look at those every 2 weeks. But I haven't read the concerns, but I honestly, I can't. I'll read through them, but viewing them.
And I'm not taking necessarily all the concerns into consideration, all right? I'm just looking at it that I'm thinking too, electronically would be much more convenient. And electronically, you know, what difference does it make? I mean, if we did them twice a month, once a month, you wouldn't have to come down here. But I don't have a problem coming twice a month here to be able to do that, at least to see how this goes and get a feel for the invoices, because just as you've pointed out several times, I haven't seen them either, right? So I have no idea what some of these are. It does seem to me that monthly does make sense, but the departments have some concerns regarding timing, and I would be better equipped to, you know, assuage some of those concerns with, if I knew what they were. if I really saw some of those invoices, just looking through the abstracts, I mean, I glanced through it, and I don't disagree with you, but I don't know if it's that big of an issue to do this twice a month at this juncture.
It's not for me, twice a month, as long as they're electronic. I know that when the conversation that we had at the last meeting about it was, we were gonna investigate what it would take to do this, to do them once a month. It wasn't a policy that I remember us saying.
It's not, it's 100% discussion.
So whether or not it changes from every meeting or it goes to monthly, and I understand that monthly, we don't meet once, a month. We don't meet January, we meet twice a week, so there's 26 meetings and not 12, so, or 24, so that's fine. I just want to be able to put my eyes on the invoices, see what the voucher is, make sure that it's going to the right account, that it's being signed off by the department head, and know what those invoices are. And if those are electronic,
I agree, and I think at this point, to your original point, I'd rather get started with this sooner rather than later than trying to drive some sort of different policy change, right? That we need to see the invoices.
Right.
So if that's twice a month, once a month, we just need to get started. And maybe twice a month right now is a good place to start.
we can get them electronic, get them there so we can all look at them. Acknowledge that we've looked at them, sign off on them, then we can do that.
Because you're the auditors for me, so it needs to happen. My question is, how do you sign off on them electronically? Do we have that capability? I thought you had a question about that at the last meeting, we were talking about that.
This is not a practice or a policy, or procedure, not a policy. It's not a practice or a procedure that we have in place to do electronically, but I can think of 4 different ways to do it. Off the top
Okay.
of my head. We just got to come up with something.
I agree, and then, like I said, right now, this is just discussion. I don't think we're saying what's gonna be policy, what's not. I think it's more important to get started and figure out where we are. So the question becomes is, can we do those electronically? I'm getting the nod.
Who were you asking?
I was asking somebody in the back, right, Renee? Well, Mike, I
clerk?
think you have to, right, you'll have to find out what needs to be done to get those
I
electronically,
think it
right?
would be me doing the scanning of all the
Right.
bills.
Oh, you,
The clerk,
Okay.
yeah.
Correct.
That's what I would have thought, because then it goes to Lori, and then
Correct.
Oh,
Not
up
the other
to-
way around.
okay.
she does all that stuff, and then you gotta do the abstract after that.
Correct, yeah. The vouchers come in from different departments. They go to Lori. She makes sure they're coded right, signs off on them. They come to me. I build the abstract. They go back to the supervisor's office for Mike to sign off on the abstract, print the checks, sign the checks, and get it ready for the meeting.
I know when I talked with Lori, I wondered if there was a way to upload the invoices into Diligent instead of emailing them to everybody. That just seemed like it would be a likely place, and I don't know if that's what Renee was nodding her head about, yes, so.
that's a great idea.
It looks like they'll just get uploaded into Diligent somewhere that you guys can see them, and then you can, whenever you're done, just send an email to Lori and Adam saying reviewed, or unless there's a way in Diligent to, there is a way in Diligent, it's okay, you
Can
can
we
just
do
mark
it?
it that way.
So assign it to a task, three board members look at them, sign off, then it goes away.
Getting some use out of that software.
I don't have a problem with the whole process, just as long as it doesn't make incredible job for everybody to do this. You know, if it's just a keystroke here and keystroke there, I'm all for it.
You guys are more than welcome to come into my office to view them in person if you'd like. I can scan them as well.
But
Just
is this gonna add more time to take away from other duties that you're doing in the office?
Yes.
Like lots and lots, or just a little bit?
This is a time-consuming part of my job. I don't know how long it'll take to scan them, but it'll take some time. Yeah, it'll take away from my other duties.
But you're not scanning them now anyways?
No.
Which was brought up at the last meeting, you kinda go, we're not, Didn't you mention that? So there's just a big box somewheres if we need to verify something?
Well, I said last meeting, the state retention schedule dictates how long you keep things like that, and there's a lot of boxes in the records room. They don't sit around forever,
When
but
was the last time you got rid of the invoices that met the retention period?
well, I've only been here a few months and I haven't gotten around to a records disposition yet. I'm working towards it though.
But you can't do that without the arts and culture director. It's gotta be coordinated with the school.
I don't think the school, but yeah, I'd have to refresh
The
myself
arts and
on.
cultural director is from the
Is-
school system, I believe. But maybe not.
I'm not 100% on that
Okay.
whole process myself, Mike.
Falls under three.
Huh, three of them?
Falls under education law.
Yeah.
The retention schedule does.
But,
yeah.
but there's a retention
Of
schedule
what you
from
can
the state.
destroy, correct.
Yeah. And when?
Yep, you need to,
Coordinate with them.
retention schedule.
Yeah, it's
Yeah, I have
LGS
it.
one.
Okay.
Yep.
I'm a busy guy. The dispositions take a little time.
Okay.
That's all.
So would it be easier to do it on every 2 weeks? Or is everything gonna pile up to the end of the month and then you're gonna really be swamped?
I would probably be pretty swamped.
Well, why can't you do them as they come in? Why can't you still do it that way as they come in? I'm just asking.
Yeah,
All I wanna do is give you the concept of
right.
how it was done when we reviewed everyone. And when we, like 10 minutes before the meeting, or when they were ready, just stop down. It takes about 10 minutes to get through, it's not a lot of time to sit there and look at them and review them. But the issue is that we're not seeing them at all. I know that not the previous clerk, but the clerk prior, Lizanne, had put that plan together to have things scanned for the invoices for them. I'm not trying to get into detail, I'm just telling you, it's not a new concept to do it. It's not something that was thought to be an extensive process or a burden on anybody who's worked with, because it's not like 7,000 invoices every 2 weeks or even every month, so, I'm not fully understanding having what your, where you're going with it, an enormous amount of extra work. The vouchers are a very important part of what your job is, so it's gotta happen no matter what. I just want you to
Agreed.
see that.
Did they, the previous clerk, did they do that through Diligent?
No, we didn't have.
Oh, I didn't. I wasn't sure. I wasn't. All right. Okay.
There,
See what? Oh. Okay. You scanned them then? Is that what they did, Gene? They just actually scanned them? How did they?
some of them, and then that process,
Well, I remember when I was a citizen, I was in there reading documents. I remember board members would come in and sit at the thing and go through them. Is that what you're talking about?
that's what it was.
So they didn't really scan them,
No,
was,
they did as
Okay.
part of a process to see how long it was gonna take and to see where it was gonna go.
All right.
And it was not, in their determination, such an extensive amount of work that they were worried about it being a local issue.
okay.
It just didn't transpire. But
Okay.
over that course of time, when we were looking at individual abstracts and individual vouchers and receipts, it went from that to us getting a scanned voucher that doesn't have any information. And that's where we've got to step. We get past what we've got to do with it.
I'm looking at the actual invoice. Mr. Kevin?
I think, I I would suggest Adam to do it and give us an idea what the time frame is on it, what the workload is on it,
Which part?
scanning them,
Okay,
or put him into diligent, or,
okay,
I mean, bring the information back to the board,
sure.
so we understand what the workload is,
Your people.
timeframe.
Only way to find out.
But I like,
Yes, I think they should be prepped for next meeting. 100%. In paper, just to look
In
at
the
them.
clerk's office.
In the clerk's office. I'm happy to come in at 4:30 or quarter after 4 to look at them.
was that the biggest concern from the department heads? Was not just once a month, just,
There's some
Yes.
other
Okay.
concerns
Did
in
not
there,
work.
but the infrequency, if you will, Dave, is the number one.
And for the record, after the last meeting, I got with Lori, the bookkeeper, got with Nate. I was under the impression, totally my fault, to try to put something together, because that's what I thought you guys wanted. Miss Lori sent it out. I should have made it crystal clear to her. It should have said draft. It caused some concern with department heads. That's all on me. But moving forward, I just want to be crystal clear what we're gonna do. It's gonna go almost like the old system, and you gentlemen, three of you will go in and review them, correct?
Yes.
Can't hear you with your mic off. Oh. Oh. Is your mic on? Just checking.
So, because Mike as the supervisor, has to sign off on the abstract when it's all for his stuff. It has been the other 4 board members that look, so 3 of us need to sign off on the individual vouchers. When that's done, then Mike can sign off on the abstract for the financial. That was what was done before. I don't know if it's technically an issue that precludes Mike from doing it, but I think best practice would be
No, you
to
guys-
keep him out of it. So, but
Correct.
I don't know, I just wanted to let you know that that was, in the past, the town supervisor didn't review those vouchers, like, and sign off on them.
Yep. Didn't at one time you guys used to come in at, you just made me think of it, at 4:30, and it seems like remember Mr. Frank and Mr. Terry, board members doing that in here?
Yeah, yes, and problematically with that, with how that would be an issue is that I would come in and it'd take me 10, 15 minutes to go through the stacks of them.
Okay.
Then I've gotta give it to
Oh.
Dave. Now, he's got 10 or 15 minutes.
Oh, okay, that's how you did
And then
it?
it goes to Kevin, he's got 10 or 15 minutes, so it's not, but so.
Got it.
So what would sometimes happen is, I'm sitting there during the meeting signing off vouchers, and I'm missing the meeting, and I'm not
That's what I
participating,
remember,
and that
yeah.
got to be a problem.
But do we have to do that, where you have to finish the stack before I pass them to Kevin?
Well, you only got one stack.
I understand
Right.
that, but
Yeah,
there's
but it-
individual pieces.
You
Right,
daisy chain.
well,
Right.
no, you
Just give 'em
actually
next to
really
each
do,
other.
because they're all separated by the account
Line
numbers.
items.
So you get water here, you get sewer here, I mean, every different.
But even if I
Budget
kept them in
line.
Well,
order,
understood.
you know, I just think there's ways to account for that. Keep them in order, obviously, you don't want them out of order, so if I had water and sewer first, or highway department, I did those and I passed that, as opposed to the entire stack.
That's on them.
Yes, I mean, logistics,
Somebody figure it all out.
that's how you can do it. But,
I was on the board
Let me
just
know when I gotta
a couple of months before the policy was changed. So I came down, but it was during the week.
yeah,
Whenever I had free time, I would just stop down. It wasn't during the meeting, so I wasn't rushed at all.
That's fine too.
right.
Okay?
We just need to get
We need to get going,
communication
right.
that they're ready. That's the only thing that we would need.
So the clerk's just gotta notify you when it's available.
Yep, until we get the process in to be electronic.
Great, awesome. Good with that, Mr. Kevin?
Yeah.
Okay. All right, can we move on,
No,
or anything
no,
else?
No, when they're ready. So they're almost, if we're gonna do that, do we wanna have them ready by Monday before a meeting? I mean, or do you just want them ready at 3 o'clock on the night of a meeting?
I gotta defer to Adam,
Yeah,
because
you
that's
gotta
his,
ask
Yeah,
I'm sorry, say that again?
so when you would have invoices ready, right? Because I'm thinking he's gonna need time to put the abstract together, right? Or would you just have it done ahead of time?
Well,
I'm,
if
I'm
you
trying to
don't- if-
understand the process of when these invoices are gonna be ready. Or-
the vouchers
Yes,
have to be done and signed off before it goes to the abstract issue.
Correct.
Because once they're approved, then the abstract can be finalized and Mike can sign it.
okay. So I'm just looking at this from a timing perspective. When, and you don't have to tell me tonight, when would vouchers be ready for review the week, prior to a week's meeting?
It would probably be a Monday or Tuesday on an off week.
On an off week?
Okay,
Correct, yeah. And you guys can, that's usually around when Lori turns them in to me. You guys can come in and view them. I can build the abstract and
I just needed to understand
get it on the
that. That's
agenda by the
fine.
end of the week.
Yep, okay, I'm good, Mike.
Lori just gave a voucher schedule, right?
I don't know that.
All right,
Okay.
anything else?
Okay.
Good.
Moving on? Yep. Gonna go to 7.3, RFP. Did I miss one, Kevin? No. 7.3, RFP for professional services and vendors. I gotta get there.
So you'll see 4 RFPs for those professional services listed. The vendors, I've been still communicating with Darren, Joy, and Greg regarding specific vendors and what exactly the procurement process that was followed for those vendors that I'd flagged as questionable. And actually, I've been largely satisfied with the responses from the highway and DPW. So there are a couple that we will be putting together and issuing, specifically Greg, I think it was like purchase of chemicals for the, what was it? The water and sewer system, and then some testing services. And then we have not been doing as much emergency repair work. And so, Greg, I think unless you tell me that you want to just have somebody available, we've not been spending the monies that had been previously. And so there's only going to be like a couple more added to this for specifically purchases of stuff and non-professional services. But you'll see the draft for certified professional accountant, attorney, insurance broker, engineering. Obviously, please review those scopes of services. You know, the engineering one did come from Alex. He's indicated this covers, I think, all the stuff that he does today. The attorney services one, I put that scope of services together based on my own engagement letter with the town, and then breaking it up as requested for services specifically to the planning board, zoning board, and the ethics board, as calling out, you know, hey, give rates or proposed fee structure for those separate things, and then also a bundle discount if there is one. The CPA services, I found a draft RFP from another municipality, which I thought looked pretty good. I think this is probably what you need. I'm not a CPA, so I would say fly it by Dwayne, but he'll also be probably responding to it. But in the response, most likely from the professional providers, they will flag if something doesn't really seem needed or not, or they'll have questions. Hey, do you really need this or not? And we'll have a conversation with those groups. For insurance brokerage services, similarly, I found a good one that I liked from another municipality, modified it for our purposes. The thought is we would issue these, you know, they'd be available to proposers tomorrow. we can put in the newspaper the notice to proposers, as soon as that's available. The bids or proposals would be due October 20th, which is about a month away. And that would allow you to potentially agree to accept a proposal October 29th, which is you have a meeting that day. It would also give you in time to incorporate that into your budget discussions and also make a decision potentially at your meeting on November 12th. Alex has a good question. Do you want these to be 1-year renewable agreements, or would you want to commit to like a 5-year agreement with anybody?
I think there was a discussion before to save on having to do it every year for at least the professional consulting side.
And there-
I would like, my opinion is a 1-year contract for renewables.
Right, that's pretty common. And obviously, they're all professionals. You could chop our heads off at any point.
Nate, what's the umbrella minimum here?
So, good question. I wasn't sure, so I will run this by the town's insurance provider, just, to give some recommendation if he thinks that these are the right policies, I mean, they're very clearly the right policies, but if these are the right limits. Alex and I were talking, he said his professional liability is actually 1 million, 2 million, not 2 million, 2 million. And I went, I think mine's 1 million, 2 million.
That's
So,
low,
Yeah, it depends on the type of thing that we're doing, right? But,
right?
We're not involved in
No,
buildings
I
falling down,
understand,
but,
but
yeah.
generally speaking, I think these limits are low, and that's why I was just curious of what the umbrella was gonna be out there.
Yeah, if you guys have a number that you'd like, I mean, I am planning on running it by the insurance provider and then using whatever they are ultimately recommending. I think it'll come out similar to this with an umbrella.
You're a million, let's say it's a million, is that like an aggregate? Like in my world, I have to have whatever policy I gotta have, I have to have it per job that I'm on.
Yeah, it's usually occurrence and then aggregate, so million,
Okay.
2 is occurrence,
Okay,
aggregate.
I just wondered if that worked that way.
This is what I have.
But five
That's
million
current.
is what I am seeing on other
Yeah,
contracts. for
it does
the-
seem low to
My-
me.
For the
in my world.
umbrella.
For the umbrella, it should be
Yeah, 5 is the,
5 for an
yeah.
umbrella.
Those are my current terms, Mike, that you guys have on me.
Okay,
Yeah, I mean, 5 is certainly, we have an engineering firm like Barton and Lejudas doing a project, we want 10, I
Yeah,
mean, because
I want whatever their limit is.
give me the money.
exactly.
For the types of services that, and I'll do whatever you guys decide, of course, but the types of services that I'm providing usually aren't life and death. So it's less likely. But again, if, I'll do whatever you guys want. Obviously, these are your RFPs.
I don't think it has to be 10, but I agree with Jay that it seems low.
Well, I think there's a big distinction between what Nate is talking about for an annual agreement for a municipality for a professional consultant and hiring an engineer to do a $50 million
Exactly.
sewer job. So, I mean, there's a big difference there. So that's where the 10 would come in. I mean, it's a representation of what the risk is if your service fails.
Right.
So, I don't have any issue with deferring to our insurance agent on what that umbrella is for these, and at least starting from there. But it shouldn't be zero.
I'd be interested to hear what he had to say too.
So what I would plan on doing then is getting Nick, the insurance guy, and putting in whatever he recommends for that. And otherwise, we can issue the notice to proposers that these packets are available. If he gets back to us after somebody's picked anything up, we'll just issue an addendum saying, here's the updated insurance requirements.
Yeah, I'd like to hear what he has to recommend, because I don't want him to recommend 0.
Oh, I don't think he'll do that. And certainly at the next meeting, I'll let you know what he's recommended, and just so you've got that and you can see it.
I'm good with that.
Yep, I'm good with
Good.
it.
Yep.
Good over there?
Yes.
We gonna
Yes.
move on, gentlemen?
The only thing about, because I wanted to get, just with the attorney services, Nate, the bundled, the ethics board has to be separate. And when you bundled it, or when you said it was bundled, I didn't see where that section D was in that or not, so if I missed it,
Yeah, let me just double check. So I, in second page, under paragraph 1, introduction, second paragraph of that, it says proposals should separately list fees for general counsel services and zoning and planning services. Oh, and then the next sentence below that paragraph, ethics counsel service fees must be listed separately from fees for other services.
okay.
You good?
Yep.
David? Yep. Okay, we're gonna move on. You good, Nate? Okay, we're gonna move on to 7.4, the time extension. Everyone see Bartla Judas prepared all the change orders and everything, her report, on all of that, and questions? Chris Fisher did not get a hold of me this week, so.
I've got lots of questions about the
Yeah.
content
Yeah.
and that's in here that is
Would you
way
like to?
beyond the scope of a conversation, other than to get an attorney's response.
Pardon, I didn't hear you.
Get the attorney's review of this letter, because
Okay,
on
So
face value,
yeah,
I don't see moving forward with it.
Didn't have.
I believe our attorney has it all, but I'll make sure they do and see what their response is.
This started out looking at a change order that was withdrawn as things advanced, and they found a workaround to their time problem. So the letter that came out on the 9th, Leeson is basically stating that everything that was in the letter from the 28th has changed, and we just wanted you guys to be informed that there's a lot going on behind the scenes to keep things moving on task. And between the applicant, us, or not the applicant, the contractor, us, B&L. So in that review on the 9th, it's just indicating we're moving ahead with a workaround, basically, and not the time change order request.
Alex, has there been any feedback from the DEC regarding us missing our deadlines?
The DEC generally
I'm
has
just
no-
saying, I knew that B&L had reached out to them.
Yeah.
I just don't recall seeing anything come back in writing.
Correct. Typically, they'll indicate that they don't have any issues, but it's the EPA is the real one that generally has the heavier hand, and they won't. They'll still submit a violation to you regardless of what the DEC says. So we still do have our hard deadline, but the state has indicated just loosely that as long as we're advancing, we should not see any ill effect from a delay, but there's no guarantee. Make sure I'm not saying that wrong.
Nope, exactly what they said.
No, I think that's what they were saying.
Yeah. So one entity works with us, the other one does not. And we're not asking for any action on
I-
a change
No,
order.
we're
Yeah,
not
I was
asking-
gonna say, what we're looking at
No.
right now is
It's
information
just a
only.
report.
In- information
Just
only.
Keeping you guys up to date.
We had a problem and we seem to have evaded it.
It's kind of
As a
a
team.
summary of everything that's been
Yep.
transpiring.
Okay,
Okay?
yep,
Okay,
thank
All
you.
right, we're gonna.
Thank you.
Gene, Mr. Gene, you good?
I am, yes.
I didn't hear you. We're gonna move on, 7.5, development moratorium to the comprehensive plan. Mr. Holbert.
Well, I know it was late yesterday evening that I sent that out to everybody, you know, or at least my thoughts on it. But I do want to at least send it, and I'll send Adam, you a copy. Well, you've got it for the agenda. I didn't know at the time that Jody would be able to get it on the agenda. But I do want to at least go through, you know, my notes on it, and I'm not gonna read it verbatim because it's there for everybody's on there, but there are some things that, as we do begin the update to the comprehensive plan, it is my recommendation that we adopt a temporary moratorium on the development requiring zoning changes, special permits, and variances, or use variances, until the updated plan is completed and adopted. Development should be allowed in permitted uses and area variances. This action will ensure that the land use decisions are made under a consistent, modern, and legally defensible framework. It's also consistent with the town board's past discussions, decisions, and resolutions, as well as the New York State guidance for comprehensive plans and moratoriums. To cite those, in 2012, we did a moratorium on gas and penetration and exploration and the support activities. In 2014, we did the comprehensive plan and we discussed it. There was no formal moratorium put in, but we had practices in place where applications weren't advanced until it was adopted in 2016. And those two, I was on the board. I'm listing these because I was on the board when these happened. 2023, we did the moratorium on the development of the solar energy conservation systems. And it was myself, current board, Kevin and Dave were on that board. And because it was asked earlier, Kevin made the motion, I did second it. And it was a unanimous vote to approve that moratorium. And then the other document that I submitted with it was the 2024 New York State Land Use Moratorium Guidance Document. There's a lot of information in there about why it's a suggested path, why it's a recommended path. But just to highlight it, and I put these in order that were important to me, not necessarily important to the process, but public input matters because it effectively without it, it effectively sidelines the community's voice and undermines public trust. In safeguarding the environmental resources, the environmental process. In my document, I want to make sure that there's a correction noted that I do know the environmental impact statement. That's not really the path. It's the seeker process. The EIS is in our RFP as an option, but I don't believe that we're really going to get there. But that process through the seeker is going to address the natural resources, the floodplains, our wetlands, and the climate resiliency. Ensuring fairness and transparency is a big issue for me. And if we don't do that, proceeding with rezonings and variances while the town's rewriting our plan would appear unfair. Some projects would get approved under the current rules, while others would go through and it'd be an outdated policy. Protecting the rural and residential character. This was a really strong comment from all the residents in the 2016 version when we sent out the surveys, and that and the town needs to determine where those updated growth areas are and the land use priorities, and pause that to prevent developments that are going to be inconsistent with how the plan is now and where it may end up. Preventing piecemeal development. That's an issue that we've got with all the rezoning issues, that it's spot development, and those have been comments that we've gotten on our 239 reviews. So that's another reason. Legal consistency with New York State town law, allowing zoning changes before the new plan's complete, risks adopting measures that would later conflict with what the plan may end up being. Avoiding conflicts with Broome County and state policies. The process that, to go through this without doing that and not bring into account what Broome County is on their comprehensive plan and would be a mistake. We reduce legal financial risk. We preserve the long-term economic stability by holding off because part of the RFP is to look at where we're gonna be for the next 10 years and 20 years after that. So there's a big input on the, on that, and protecting the infrastructure, the planning. So that's why I'm, you know, recommending it. The temporary moratorium, it's a prudent, time-limited step to protect the town's interests, and I just, from my point of view, I do not view this as anti-development. I really do think that this is, you know, a responsible government, action that, to preserve the integrity of the town. Not any individual developer or any individual homeowner, you know, whatever the project is. So, with that, I know there was another document that I gave, that I passed out. Those are different alternatives. I listed some pros and cons to it, but.
Are you referring to the last one?
I'm referring to the document
MA?
that was MA,
Okay.
the moratorium alternatives.
Yeah, okay.
And there are options to doing those. They're mostly problematic from my point of view because they don't protect the town in whole. Some of them take longer than a moratorium process would take. And there's a lot of regulation that has to go into them for some of the choices. But one of the key parts of this is that I see this as a limited time. We've got an RFP out. We've earlier decided to start negotiations with that firm to complete this, and it's an October 26th deadline. And if we get that done, then, you know, in place, we've got an approved comprehensive plan by December of next year. So I don't see where there's anything but to stop this and get it right. And that's what I've got to say.
After the people do our comprehensive plan, it comes to us, then we're gonna refer that to the planning board, so there's a time in there for their advisory opinion?
Yes, there is.
Then whether they, no matter what they give as an advisory opinion, then there'd be the public, they'd already have had the public hearing through the comprehensive plan program, correct?
So there's probably a total time frame in there, and I had laid out the time frame, you know, at the end of the document on where it is. But because the committee is going to be made up of town board members, planning board members, community members, citizens, you know, that information is not going to be cold information to the planning board when they get it in October.
Mhm.
So at the same time we get it, we forward it to the planning board. They've got 30 days. It does have to go through the 239 review period, so it goes to the county as well. We get their comments.
But that's usually, there's a time limit on that, right? It's this
Nope,
30 or 60
30
days?
30 days.
30
It's
days
30.
back to us.
30 days from the date that they receive it.
Okay.
And then the public hearing.
So I'll interject a little. You don't have to send it to the planning board for an advisory opinion. You send your rezoning laws to the planning board for an advisory opinion, but there's no requirement that you refer the comp plan to the planning board. You know, that's one of the ideas of having a special committee handle it, composed of constituents, including members of their planning board, your zoning board. You know, so you could shave at least 30 days off of that timeline. You can refer it to your planning board if you want to, but it's not a requirement.
But if they're already, a couple of them are already on this committee, then
You've gotten some
it's kind of
feedback.
redundant, isn't it?
Yeah, and one of the things that another client of mine is going through right now, you know, they are not referring it to their planning board, but, you know, they're reviewing each chapter and holding, they actually are having their special committee hold the public hearings,
Right.
not the town board itself. You can choose to have the special committee hold the public hearing and a town board hold the public hearing. You can have just the town board hold the public hearing. Their thought process was the special committee's tasked with putting this together. They should hold the public hearing because then they can make changes to it when they refer it and then give a publicly commented on product to the town board for action. But this is all stuff that the consultant who you end up hiring will recommend to you as a process, right, one way or the other.
Well,
So-
the only caution that I would have with that is, as a town, we only have two types of committees that we can form. And that's either a board committee or a citizenry committee. And if it's a citizenry committee, we can't transfer any power to that board. So it all has to come back to us at the end.
Eventually, yeah.
And if it's a makeup of planning board, town board, citizens, business owners, I don't know how that can be a town board committee unless we're all there.
Yeah, the statute expressly authorizes the special committee to hold the required public hearings.
For
So-
towns?
Yeah, it's for towns.
Okay.
Yep.
But there's not a transfer of authority.
No, it all
No.
comes back to the town board for final
Right.
approval.
So the
okay.
special committee holding the public hearing would be in lieu of the town board holding the public hearing, or do we need both?
It would be, it can be in lieu.
Okay.
You can choose to have it in lieu, you can choose to have both committee and board have separate hearings if you wanted to. But again, I think the consultant will come in with their kind of, and maybe they talked with you about like what they see as the timeline, but they'll come in with, hey, here's what we're planning on doing, and work with you and the special committee about what's the best way to roll it out for your community.
Kevin, Dave?
Well, I didn't get the information until 9:30 or something last night, so it's kind of fresh to me, you know? So I haven't read through it. But first take, I'm not a fan of the moratorium. I think it's too broad. If it was narrowed down to a specific, like solar again, or gas, or whatever, but for none of the ones you had here for zoning change, special permits, or use variances. I think the town's been very lax in updating code and zoning, that we do have a lot of problems, that people have to ask for certain ways to get things done. So I think we're penalizing people who have good ideas to produce things, to develop things, but they have to go through these things that haven't been updated. So I want to make sure that, it seems like a long time for a year. I guess your impetus is because we're so close to doing the comprehensive plan that let's just suppose they take a year off and get things right by getting people's views, but say that we go through and find out people like the way it is right now, so we just wasted a year of somebody developing something, or moving in somewheres.
Well, it's not wholesale, because if it's a development in a permitted use on a permitted property and they don't need a variance, then,
Or a special permit.
or a special permit.
So,
But-
it's like, for example, a solar field needs a special permit.
Right.
Yes, yep.
Or some other issues that might be coming up shortly.
Yeah, they,
Mr. G,
Yep.
Mr. Jean, I want to make sure I heard you right when you first spoke. Did you say a moratorium, but excluding area variances?
the moratorium that I wrote into the document was for zoning changes, special permits, and use variances.
Well, what about area variances?
I don't see area variances as being an issue for the process of the comprehensive plan, or the part of the comprehensive part of that the firm is gonna look at our zoning ordinances as a whole. You get a use variance, that's a completely separate issue, that's the whole zoning issue, zoning stuff, so that's why that's there. But if somebody's got a height of a garage, or they wanna put something closer to their back lot that's on a setback line, I mean, that's an area variance, and I guess from my point of view, that wasn't inherent, that's gonna really change anything in this comprehensive plan issue.
But I look at it, if you're gonna put a moratorium on zoning, then you should put it on all area variances, because someone could have split parcels, they could have, where the front side is, residential and the back side is commercial, and now you're gonna allow the ZBA to give an area variance to crowd onto the next property, where most of the time when you have commercial property and residential property, the term everyone tries to use is the buffer, to buffer it. So if you're gonna put a moratorium on all zoning, I think it should be everything that the ZBA does. Because the ZBA, not only that, with your ordinances, the ZBA determines the decision. The public always has the right to challenge the code officer on a decision regarding zoning, and they appeal that decision to the ZBA. So the ZBA, while this moratorium's going on, could actually be doing the same thing that you're talking about, that is gonna undermine the comprehensive plan. If you're gonna do something like that, then I think you should do it across the board, or you gotta really, to David's point, it's either gotta be encompass it all, or you gotta define it like you did with solar, or you did with gas drilling, to a particular item. That's just my opinion.
Well, there's no way, the comprehensive plan is just a different animal. You can't isolate it to,
But you're putting a
a renewable
moratorium on
energy issue. That-
all zoning changes until the new comprehensive plan is there, which is okay, if that's what you're gonna do, then you wanna stop the ZBA from continuing the problem.
I understand your point.
Okay.
And
Just-
I think it's valid, I just, it could be there or not. That's adding a higher restriction. But I have no objection to it, I just didn't think.
Well, it's just my thought on it.
Yeah, no, it's a valid thought, yeah.
And right now, we have multiple solar projects that are approved, I understand that, but to Mr. J's point, they have to have special permits. We've got planning board meetings that are having public come out, a lot of public are coming out speaking against it.
Well, that goes more to that goes more to support the argument of a moratorium than not.
Right, but then it ought to encompass that too, then.
It does.
It does
Okay,
encompass
all right.
that. Clearly, he had
With
right
the-
in there
with the-
special.
With the permit process.
With the special permit.
Okay,
But it doesn't address any of them that are in the process.
Well,
No, it does. If
it
they're
does.
not, if they don't have a permit, it does address them.
It would stop them
Yes.
from
even
proceeding.
though the application is in?
Correct.
Yeah,
Yes.
because they're not permitted yet.
They're not permitted, so it would, if it has not been approved by the time, but let's just, under the concept that we agreed to put a moratorium in place, at the time that the moratorium is approved by the board, no board, ZBA, zone, or planning board could process an application any further.
But there's a process for the moratorium too.
There's a public hearing.
So, how many zoning changes were made after the last comprehensive plan?
0.
Okay, that's my concern.
Absolutely, that's a huge
That's,
issue.
that's my biggest concern about this whole thing, is if we do this for a year and then we just take the same path we did last time, then we just wasted, like Dave said,
Yep.
a year of somebody possibly coming in and developing. Because no, we didn't follow anything that was in the last comprehensive plan.
Right.
No.
No, we didn't.
And that's
So
partly why
how
we
do
have the
we,
mess on
how
Front
do
Street.
we, how do we make, I'd be for it, the moratorium, if we are going to change the zoning, whatever's adopted into the comprehensive plan. If we're gonna follow the comprehensive plan and change
Right.
what the people in the town want, we need to change the zoning to that.
And you're right, yes, that's our
But we
responsibility
need
to do that.
I want something in place that we're gonna do that.
So,
Cause I might not be on the board when that happens,
Right,
you know, in 2027 or whatever.
Exactly.
I understand, I do, I understand your comment, but all there is guidance that puts the responsibility of the town board to follow through on the comprehensive plan recommendations. If it lists out 10, and I remember the conversations that we had, there were 7 or 8 recommendations in the comprehensive plan, and the town board prioritized them, and some of them were really low. And they weren't gonna happen in the time period over the 10 years from that. But the town board has the obligation to implement and discuss each one of those recommendations and move it forward. The other failure in this process was that the planning board and the zoning board of appeals didn't hold
That's
the
what I just
approved
wrote down.
comprehensive
That's the
plan in
problem.
the process of evaluating the site plans and the special use permits and the zoning appeals. So nobody held anybody accountable for it,
No.
starting with us. And
Well, the 6-acre thing comes to mind down Front Street.
on the PDD.
And that's
Yes.
one of my
Yes,
concerns.
Yes.
Yes.
mine too.
You know, there's a lot of concerns like
Yep.
that.
Yep.
We all
Yep,
lived through
yep,
so.
So,
and we,
Kevin, might I suggest, considering, you know, if you want something, it sounds like you would like something that's like, hey, we're gonna implement the zoning code change, right? So another client of mine, they committed to hiring a consultant when they were doing the comprehensive plan to do the zoning change. They didn't have that person start on the zoning changes until, of course, the comp plan was done. But like, they put out an RFP to hire somebody to work on the zoning code and hire that person, you know, as they were going through their comp plan process. It should be, if you follow through, as Gene is saying, you finish the, you start the other. So if you have a contract with somebody, you know, that might give you some, or others, some assurance that you'll follow through.
Yeah, and I understand that, but I can't speak for what the public or what the town people are gonna want it. I remember what happened last time, but I can't speak what's gonna happen this time. So there might not be a lot of zoning changes, who knows?
yeah, we don't know.
I don't know. But I understand exactly where you're coming from.
But how do we protect when the town board had comprehensive plan 2016 and before? So the board goes and has a comprehensive plan because that's requirement by the state. But the town board is supposed to be separate and is separate from the planning board to ZBA and doesn't always know what the planning board and ZBA are doing. So even if we do this process again, what keeps, how do we stop that from repeating itself?
Well,
Because
it,
is that what you're saying?
One, it's
Someone's gotta
a-
police that.
one's education,
Okay, yeah.
The
Okay.
board.
and the other is, you know, check and balance system. I mean, we've gotta make sure that we're getting it.
I guess what I'm asking then, where is, in your opinion, where are the checks and balances?
So they sit here, the 5 of us,
Yeah.
they sit there with the town attorney,
Yeah.
and they sit there with the town engineer.
Okay,
And those applications have gotta be reviewed, and part of it is maybe just the, you know, the applications for the site plans, you know, have to be just a little bit more clear on, you know, what's going on with the comprehensive plan. And you can't have applications that go in and, you know, I'm in a PDD and I wanna reoccupy this building, but, you know, I don't need 6 acres, so I'm not gonna buy that property, so give me a variance so I don't have to have 6 acres to do this job. You know, those are the things that have gotta be passed on and incorporated into it. If it's not consistent with the comprehensive plan, you know, I wish it was just like a formula that where you could plug it in, but every application is different, and it's gotta go through the process, and it's gotta be fair to the town, and it's gotta be fair to the developer.
so
And the
that,
residents.
that was always my point about why the ZBA should have a different attorney than the town board. Because in the past, in the history of the town, excluding our current attorney, the attorney is advising the ZBA, which is handing out variances. And that's part of the reason why we got the mess we got, and that's why I think the town attorney should be separate from the ZBA. So that ZBA attorney is saying, we're gonna hold you to this, we're gonna hold you, and if that attorney is allowing them to give out variances, just hand them out like candy, then our town attorney would challenge the ZBA. And in some towns, they actually end up in court that way. With that, I think, is the checks and balances, but when you have I'm not trying to be disrespectful to you, but when you have one person, that the attorney advising us, and then that same attorney is advising the ZBA, which can just hand out variances, which once they're handed out, you can't run with the property, I think that's a problem. I think the checks and balances that you're talking about needs to start right there. Because otherwise, there's no checks and balances.
No, but you know, ultimately, it comes back to the 5 board members. So, you know, from the ZBA, I cannot tell you that I've ever seen a report from the ZBA to the town board saying, here's a list of the variances that we've done in this year, in the last 5 years, it isn't there. So I have no idea what variances are actually getting approved. So, I mean, that could be part of the check and balance system too.
Well, the way I understand it, when I got involved in this, the ZBA is supposed to follow the criteria of the state, and they're supposed to review the documents that are before them. If all of a sudden they're getting a lot of signs, or they're getting a lot of ZBA requirements and they have to shoot them down, that report is supposed to come back to the town board to say, hey, you might want to look at your ordinance over here because we're having to deny these. But that's not what's happened in this town the whole time I've lived here.
Well,
It's not what's
You
happened.
go back to 2012, 2014, that's 12 and 14 years ago. It's a completely different board.
I
And
understand.
it's a completely
Dan.
different culture, and the education level on the board members are there. It's a different situation, so I don't disagree that that was a problem, but I don't think that that's the culture anymore. So I don't think that we're gonna have as many problems with that, and we have the opportunity in this process to tighten up a lot of those holes.
But to Kevin's point, this board right now, that quality that you have, or however you just describe it, could change in a year and a half. So the process has to be a little bit more so that the children don't run amok.
Who appoints the planning board members?
The planning board, but that's
No,
not
no,
where,
no,
the
no.
town
Who-
board, the
Town
town
board.
board
Right
does.
then. So-
I'm
so-
talking about the ZBA.
Who appoints some ZBA members?
The town board does.
Exactly.
Yeah,
So-
but once you appoint the ZBA, you are then separated from them.
I'm separated from them, but if they're not following the
But you
process.
don't even get the reports. You don't even know. When I started, I
Did
used
you
to-
ask for a report?
Mike,
I understand,
Mike,
I know
Mike,
where you're going.
Mike,
When I was out there, I used to challenge the board, and it came multiple different people, and you guys didn't have a clue what was going on in the ZBA. When we used to have meetings upstairs. And that's my whole point, because the ZBA was being controlled by the same attorney the town was being assigned to. And it didn't happen, Gene. I understand what you're trying to say, but that's not what happens.
Well, I think you're getting off topic on
All right.
on the intent of what it is. That's really down into the weeds of where it is. We got a lot of opportunity to fix those issues.
And if we don't have the checks and balances before long, while we're off the board, it'll be right back in the weeds.
So make it so it's there.
Part of
I've
the
always advocated for written
That's why I want a
policies.
different attorney for the ZBA, not the planning board, I don't care about that. It's the ZBA, because that's where it causes us problems, in my opinion. That's why I've
I'm
always
glad I
advocated.
started this conversation.
Go ahead.
Because we got a year, if we got a year to figure it out.
Yeah.
Put stuff into place.
Right.
We could write policy, we could write.
Yes.
One simple thing I might suggest, if you guys want reports, have the chairman report.
Exactly.
One might think of them as department heads, put them on the schedule.
And the ZBA should come and say, we turned down, if the ZBA was doing it to the restrictions of the state, they would turn down more than they approve. And then that would come to the town board either by the public not being able to get their variances because they're all upset, or the chairman of the ZBA would come and say, look, we've had to turn down 15 of these. You might want to look at it.
This board, the town of Shenango, has a town clerk who is legislatively the board's clerk.
Mhm.
We also have a town board clerk, Jody.
Mhm.
We have 2 people in place that can acquire the board's minutes and give us that report. That could be your supervisor's report on what happens every month. We don't have to make up, we've got control of it within the structure of this board and the people sitting here at this table.
Good. We need the
Is an
structure.
option. I just throw it out there. So when we've got a lot of time to figure out 90% of the problem.
Good conversation, but where are we going now? Where are we going with the topic we're on?
Yeah, And I agree with that, and that's great information, thanks, Gene, but to stay on topic, I think we move back to the discussion regarding the moratorium.
Go ahead.
So having that discussion there, I would be in favor of that, moving forward with a public hearing. I'd like to hear what the public has to say for this public hearing on the moratorium.
So the,
Could we have just an idea on the variances?
I
Use-
would include the area variance as well. I think Mike's point is valid.
I would agree to that.
So then I would make a motion to,
Gene,
to
if I can.
prepare-
Yep, sorry, I was gonna interrupt. I was hoping you weren't gonna schedule a public hearing, because I was
No,
gonna say,
no.
I gotta put a local law together.
right, to prepare, to prepare a draft for, the local law for a moratorium on the development within the town that that relates to zoning changes, special permits, or variances.
All variances.
Well, those are three things, and I'm saying or, so it can be any one or all three.
Okay.
But I'll let the attorney get the legalese on it.
Gene, can I update the timing? You mentioned December. Colliers, who you selected, has an 18-month time frame unless we negotiate them at 15. But either way, 15 would be end of January for them to complete the comp plan. 18 months would be end of April.
No, from my notes from the meeting, their schedule was 12 to 15, and 15 included the EIS.
Yeah,
Yep.
so they chopped it from the 18 that they had in their plan.
So when we
Dur-
go
during-
talk with them, we'll just have to get them to
12
stick
to
to the 12 to
15
15.
12 to
Yeah.
15.
I have the same as you
Yep.
from the meeting.
Sounds good.
So Alex had pointed out, so there's a variety of special use permits, of course, under your town code. I think one of them is keeping more than 3 dogs.
That's over to the planning board.
Yep, that's the planning board. And then there's, let's see, light industrial businesses in the PDDC. There's restaurants in the neighborhood commercial, eating and drinking establishments. Those are the schedules that I opened up. So just, I think, Alex, you looked at one that said professional offices.
Yeah, like I
in-
can put an office in my house until the moratorium's lifted.
Yeah, so just be aware when we say special use permits, it encompasses all special use permits unless you get more granular.
Well,
And that's for the special use permits or the variances?
Special use permits.
You made a motion, right?
Yes.
Do we need to have a second before the discussion here?
I second the motion.
Okay, so now we're into discussion.
Thank you.
Yeah.
What's the liability? What's the liability to the town?
A lot of
If we-
people.
If we nitpick special permits?
Yeah, you have to have a rational basis. You have to have a reason for it, right? And the reason, the rationale that Gene has expressed, I think, is a sound one. You're in the middle of updating, you're starting the comprehensive plan update, you want to get that set, and then you want to roll that into zoning changes. Every moratorium has release valves. If there's some special unique hardship on a property, they'll be able to apply to the zoning board for relief from the moratorium itself. Like, that's just, you have to have something like that. It's hard to get. It's like a use variance level criteria, very difficult. But when you start picking and choosing amongst the things, you need to have a good rationale as to why you're
That's
pulling it
what I'm
out.
asking. If we nitpick certain things, or we pick, then we're liable.
Yeah.
We have to have, all right. I'm good with
What were you
all
thinking with
special.
that, Kevin?
I'm good with all special permits.
All
Because-
special.
All special permits, because if we start, and
This would have wiped out this month's entire planning board agenda.
Yep, I
I
understand.
get
All-
that,
All
but
applications,
Yep.
chickens,
I look at the
everything.
liability of the town.
If we're gonna fix it, we have to do it right.
But that's also one of
No.
the things that we avoid, is that, everyone has known that we've been talking about revising the comprehensive plan for the last year.
Yep.
So we've got, one of the things is a rush to get things approved before we get through there, and we're at that point where we got to stopgap.
And I do agree, we have an opportunity to try to fix some of this. I'm just trying to point out the habits that happen, and I want to put up as many guardrails as we can to avoid that in the future.
I guess what I don't understand is that we're saying we got enough time to get research and feedback from the people to correct or change things. What's the process of correcting or changing things so that we're in line with what the people want? Like, we have to change zonings,
Yeah.
laws?
Yep.
But doesn't that
Yes.
all take time, like,
Yeah,
like-
Dave,
like years?
it's gonna take the comprehensive plan timeline, which is 12 to 15 months, and then it's probably gonna take another year after that to get the zoning changes
So we're
done.
telling that this moratorium might go on for a couple of
Probably 2
years.
years.
No, so,
No.
so that's what's really good about,
That's
about
not-
the issue is that once we.
That's where I'm getting hung up on.
Okay, so once we have the document in hand, and here's the comprehensive plan, that the town, I do support sending it to the planning board for their referral. Then the town board gets it and adopts and says, here it is. That gives the planning board and the ZBA the document in hand on what we're supposed to be doing. So we can start taking applications, and they can be in compliance with this plan before we get to this, before we change the setback on, you know, or before we can say that there could be 7 outbuildings on a ag district issue, whatever.
But you can lift the moratorium as soon as you have that.
As soon as the comprehensive
Yes.
plan
Is
is in place,
adopted.
Yes,
the
and you can
moratorium-
accept the applications and start that process.
I thought that we couldn't get out of it, the moratorium, until all these things
No.
had
No.
a cure.
No.
And I'm going, this is crazy. Okay,
You might want to continue the moratorium on certain categories, depending on what the comprehensive plan says about the thing and where it's presently allowed
But you can visit
in
them.
your zoning code. Because if the comprehensive plan says we don't want a particular thing in a residential district, but your code allows that thing, your code and your comp plan are then in conflict,
But can't we do the moratorium to that
You
specific
could.
use at that time?
you could, right?
Right,
But
we
so we'll-
can't anticipate what
Right.
that comp plan is gonna look like until we have it in our hand.
And I'm bringing this up, Dave, because there might be a continuation of the moratorium on some category of things once the
Specific
comp
things like
plan
you've
is
done in the
done.
past.
And the new comp plan or the moratorium has no effect on pre-existing, so it's,
Right, yeah, pre-existing things would
Yep.
be, and those are things that have been approved,
right, prior to it.
right?
Prior to the application process, just because someone has the application, the moratorium stops it, because the only way it wouldn't is if they had the permit, they just hadn't started work. Then they could.
Yeah, it's the
So if
vested
it's
rights
yeah,
argument,
yeah,
and
normal,
even
yeah,
sometimes
I'm
if
good
a
with it.
permit's been issued by a board, but they haven't actually gotten a building permit, you know,
Yep.
they might still lose out, so.
No.
Okay, I'm good.
I just think the timeframe is important for us, and I don't know why this can't be, you know, a month away for a public hearing.
Yeah, so it would be, at the next meeting, I will have a moratorium draft for you to introduce, and then you'd schedule your public hearing. And then, that's the type of thing, it's a zoning change, so you'd refer it to your planning board under your code.
And we
And
might wanna
then we-
secure a bigger venue.
We need 239 review, and you would probably potentially want a bigger venue. 239 review is, of course, the thing that is the 30 days, right? But we might be able to get a faster turnaround on their review because it's a moratorium. There should be no intra-community impacts, and so no 239 comments, but you still have to do it.
And if we're gonna do that, we need, in my opinion, we need a bigger venue, and we should just schedule that.
So were you thinking, Nate, that would be the 29th meeting of October?
Potentially, because we're talking about introducing on the 1st, so that'd be 28 days later. Yeah, we might be able to swing that. It's gonna be the 29th or possibly your first meeting.
And the
Gene, I think
first
from
meeting
your
in November's
perspective, you'd rather
budget.
do this sooner rather than later, right?
Yeah.
So we have the budget first in November, the finalization of the budget, public hearing for that too.
Yeah.
We're having a special meeting to work session, but we still have to hold the public hearing for the for the budget. That's November. But if we're gonna put a moratorium on zoning and permits, which I think is right, to try to fix this problem, I think maybe what we should consider is having a special meeting, secure maybe Shenango Fork School, and that's the only thing on the agenda is the moratorium.
That's fine with me.
That's just my opinion.
Actually, it's a
No, no.
great idea.
Yeah, because I don't want to get into a situation where we've got to cancel a meeting.
Exactly.
Yep.
So, just, you'll have to reach out, because we did this before.
To the school.
Reach out to the school and find out which dates are available.
Okay.
And
Right.
probably have to communicate
Alright.
with the board and.
So,
And then,
so the planning board right now is actually scheduling in anticipation of 3 solar developments, all being on their agenda at the same time. Special meetings at the school the 4th Monday of every month, at 7 PM, just, that's the solar development day. Cause otherwise, this meeting room is not adequate, and we'd shut down the normal business, which is what happened the last time. So, they meet at 7. If you guys wanted to meet at 5, that same day, we could probably
could do
swing
that.
that, and if you guys adopt a moratorium,
then it stops.
then the planning board doesn't need to
It would stop
meet.
the planning board issue.
Yeah. What's the, what is that date?
that'll be the 4th Tuesday of October, which would be the 20,
Monday or Tuesday?
Monday, excuse me, the 27th. So that'd
Of
be
October.
Of October.
I'm fine with that.
Yeah,
Me too.
me too.
Just see what the school says.
Yep. We'll see, we'll get a call into the school and
Yeah, I think Renee and Diane are in touch with the school folks about the
You got a
dates and
contact?
stuff, so.
you do? Thank you. All right. I didn't hear you, Alex, what? Oh,
Just wondering myself,
all right.
scheduling in my head.
Okay,
Vote,
take a vote, Mr. Clerk.
Mr. Warden,
Aye.
Mr. Simonis,
Aye.
Mr. Johnson,
Aye.
Mr. Hulbert,
aye.
Mr. Lumsden.
Aye. All right. Where am I, Kevin?
Ordinance report.
Ordinance report. Everyone's, thank you. I gotta get this. Everyone see that? See the redactions?
Yes.
Conversation? Good?
Is there any hardship with producing these reports? Like, are they problematic, taking up a lot of time? Preparing them for the board this way? Okay.
You're good with
that's
it?
fine. Good, thank you.
Perfect. Thanks, Renee.
Are you guys good with it?
Yes.
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 Thank you.
Thank you.
Yep.
Okay, can we move on?
Yes.
Okay, we're gonna go to 8.2 DWP report. Yes, go ahead, Greg, wherever you wanna
There's
go.
a few things that you'll see here. First, Alex and I met with Keystone, working on the secure vestibule. You'll see a letter that Alex and I created to you with a few questions that we had and things if you wanted to incorporate or your decision-making on it or opinion. The other thing you'll see is just a quick design of what they drew up. We were just looking quickly for if there's something different you guys were looking for.
Greg, you said Alex had questions in here?
There was questions in the letter that I wrote, just asking
Oh,
for
in your
board
letter.
input for recommendation.
Okay.
Questions?
I was not looking to give feedback on the vestibule, so, but I can, but I just can't, I'm not prepared to do that tonight.
We don't have to do it tonight, we just,
I know that one of the things that we had discussed was the security keys and fobs policy, making sure that Keystone had that so that they could coordinate that with their access. I want to make sure that they get that. the town board about fobs and access to doors.
Going down further, yes,
Next one down.
yes.
Yep.
I was asked to, secure pricing on door fobs. See here, you'll see, the cost.
You got the cost? I don't have that.
Yeah. At the bottom
Yep.
of the invoice for the quote.
It's labeled, Town of Shenango Door Access Editions.
Oh, okay, yep. I was still on the door fob. Yep.
Does, does this incorporate, access pads or access, proximity readers for the fobs at all the exterior doors, as well as some of these interiors?
All the ones that are listed are, they will have them attached to them, 6 of them total.
But these are all, but, are these are, I looked at these as all interior doors.
They're the doors to the supervisor, to the assessor, to the break room. Then there was one for the entrance to the highway secretary's office. There was ask of one for the entrance to the highway superintendent's office. Then there was an ask for one on the highway mechanic's door. Does not include the internal one in the highway department's office, no.
And I'm looking down past this with the whole security plan for that. All of the exterior doors, the highway garage and the town hall have exterior
Yes.
badge readers or fob readers?
No, not all.
Okay, I'd like that added.
Which, Greg, what you're missing, does the highway department have exterior?
The public works door on the far left does not have a fob access, but the public works office has a fob access.
What about at the highway garage?
The highway garage goes through the front door that has fob access, and the back door has fob access as well.
All right, so the exterior at the highway department has,
Okay,
There's only one door that lacks fob access, and that's the far left door for the public works department.
and this one here does?
This is an emergency door, this one does not have one, no.
that's just emergency exit only?
Right.
Okay.
There's no key to get in.
Would you,
Yeah, okay.
Alex, Gene, do you
But
normally put a?
there's no core key on the outside?
No.
Yeah, there's no,
I don't think so.
I don't know.
Oh, it's gonna go off, ain't it?
No,
There's no,
the alarm's not on.
Oh.
there's no alarm on there.
No handle, no.
Okay. All right.
It's gonna go
Do you want a price on the?
Yes, I do.
Yes,
Yes, get a price.
definitely add
Yep.
that.
Okay.
And I have no objection to the location on these.
Okay.
So, I don't know what you guys are thinking.
You going to your levy?
If we're done with this topic.
Oh, sorry.
Are you
Get-
good,
hey,
are you good
Di-
with the fobs at the
Di-
highway garage?
Darren? Yes. Sorry, Mike.
I sent an email to the board on behalf, yesterday, I believe, all the board members, asking that there is no reason for me to request that. I don't see any need for this. There's no reason for my mechanic shop office one to have one, and no reason for my one going from the, garage into my office, because that doesn't even have a lock on it, it's really not like the exterior lock going in or a hand, thing from that. I'm just looking at one going into Joy's secretary's office, right from the main entrance.
Darren, I thought you asked for the mechanic when you were speaking with me the first time. I thought you asked for the mechanics.
I asked
To
to look
protect-
at it. and
Oh, okay,
Yeah,
okay.
I didn't say we wanted it. But-
Well, no, I was
Yeah,
just
no,
getting
no.
prices.
Yeah, right, and looking at it
Okay.
all, no, I'm just saying, looking at it, it's gonna make it harder because my mechanic's gonna go out of his office, he's gonna lock the stuff in there, going back and forth. I'm gonna go out and shop and give some reorders, I'm gonna have to go out. It's-
You know, that's
To
fine.
me, looking at it ahead, to safety concerns on that building, the only one would be that office. The only other two that I just quick. Exterior doors on the garage that do not have fob are the two corner ones on this side. On the side of the building, exterior going in.
Okay.
Where is
So
he
there are
talking?
two more, just throwing that out there. for those.
Where
Oh.
are they, Darren?
There's two on the side of the building right over here. One is.
As you go around the corner?
Yeah, one is actually right by the lockbox for the fire company, where they use the lockbox.
For the Knox box. Yeah.
Okay.
I think we should add those.
Yeah, I do, and Darren, I understand your comment, about the safety issue, but it's also a security issue, so some of these interior doors, I still think should have fobs on them, but I would like to get a plan that shows where all the existing ones are, and where we should, where have the opportunity to get input on where we want fobs
Didn't
for
you guys
exteriors and
get a
interiors.
report before, like 3 years ago on what, didn't you guys hire someone or?
Broome County Security.
Oh, okay.
Sheriff's
They
Office
mentioned
came.
the one at our office and Joy, pulling it to the secretary.
Yeah.
That's the only one they recommended.
It's hard for me to piecemeal it without seeing a drawing, so I wanna see a floor plan of the building that shows where the existing fob readers are. And then I can put these together on a map, and I can
Do we
look
want
at
to hold on getting pricing for the 3 exteriors we're talking about?
No,
This-
we still,
Yeah, I
give
I
pricing.
would get that pricing for those 3
Yeah.
exteriors.
yeah,
and-
I
but,
just don't wanna miss it. I don't wanna
'cause
go
if-
through and say, yeah, we're gonna do
Okay, so then
$13,000, and then next week, we need
Yeah,
another.
We need 2 more.
Right,
Right.
Right.
So
Doesn't hurt to get the
you can
pricing.
produce, Greg, you can produce that map to
Yes,
show.
yes, sir.
Do you understand what
Absolutely.
Gene's saying about, he wants, what do you want, a
I'm
drawing?
gonna work with
Yes.
Alex and get a floor
Yeah,
plan,
okay.
and then we'll
All right,
put them on the floor plan. And I'll put in where we want to put the new ones.
Yeah,
Yeah, we can do it.
okay, thank you.
Also, here's the re-levy report. I have to have this done before I can do my first quarter billing in October. So, as you see here, once again, we're over the $100,000 range where we re-levy. 88,700 of that is sewer charges. The rest is water charges. So, I need to have this done and the resolution done so we can get it to Broome County so we can clear our books and do our first quarter billing in October.
What do you need from us?
I believe the resolution authorizing the re-levy, which is on the bottom.
you got a lot here. Is this the last one, Greg?
What is that? Oh, it's, I kept looking at the one on the PDF attachment.
I'm sorry,
No,
Yeah.
Next section.
in the resolutions.
got it, okay. Okay.
Lastly, I spoke with the union steward. I drew up, with help with Nate's recommendation, I drew up something stating to them that we were looking to possibly, we could find the operator to allow to pay more of a higher rate. I came up with the two figures. I gave it to the union steward. He then went around to the union members that were here and got a vote of a 3-to-1 majority vote that they're in favor of allowing the town to raise the rate for the wastewater operators, if we even get any applicants. As of today, I do not have an applicant that has a license at all.
You do or don't?
I do not.
How long have you been advertising at this rate?
We put a variable rate from 26 to 34 to 24 to 31, since the last time you gave me approval to go out to do it, so it's been almost 2 weeks, I believe. We just put just in case you guys chose to
Yeah.
allow it to go higher.
Well, we can't go higher unless we go back and get
To
approval from the.
get approval from the
right,
union.
so-
Correct.
Yep.
Right.
So,
This was what I figured was a good starting wage in
Yep.
Broome County that I found, has not taken any traction as of today.
Okay. Anything else, gentlemen?
No, but I'd like to revisit this at the next meeting to see what, applicants are in there and have a have you send the board for the next meeting, an update on it.
Yep.
If you got applicants, what your thoughts are on how to address the situation.
Okay.
Is this a 40 hours or 35?
40.
Okay.
I do have a few things to ask for a future agenda topic. We can do that now or later. That's up to you.
I think now is appropriate, and we'll
So
decide
do I.
later.
Yes.
Just checking.
Yeah.
With everything going on in the water and sewer department, with budgets and everything else, I think we're in the point where we have to do a rate increase. I'd like to see that on the agenda for the next scheduled board meeting if possible. I'll have all the figures, why we need to do it. As you see with the re-levy, we are $88,700 negative at the sewer treatment plant budgets because of non-payment for water and sewer bills. My other ask is I have open position in the public works for crew chief. I'm looking to advertise internally with one employee in particular that qualifies for it, see if he'll apply for it, and see if civil service will qualify him. Then I'm asking to see if we can advance him to that position. That would leave a wastewater maintainer position open, which we have one current laborer who qualifies for the 2-year mark. We'll have 2 more in the next 2 months that will qualify. That would be a job if we would advance the maintainer to the crew chief. I'd like to fill the maintainer role internally as well. So I'd like to advertise that if you guys so choose to allow me to.
Okay.
And that'll be, okay.
That's a future.
Yep.
Future?
Yes.
And all that narrative and all that rationale, you'll be able to provide the documents for an agenda topic?
Yes, sir.
Okay, thank you.
We good?
If he's done,
I'm done.
okay.
Okay, we're gonna move on. Attorney's report.
Yep, you'll see the typed up one there. You'll note in the middle of it, there's 2 items that you, if you want to have an executive session for matters relating to employee things, appointment, promotion, discipline, suspension, matters involving employees. You don't have to. I've talked with several of you about some of these things.
Well, I think we need to.
Yep. Do the resolutions, then we'll go to that. Do the public speaking. You in agreement with that, gentlemen?
Yes, at the end.
Yes.
All right. Get out of there. All right, next, see the supervisor's report, gentlemen?
Yep.
Any questions?
I have none.
None.
Resolutions, Nate.
Resolution 9.1, approving abstract number 19.
So moved.
Second.
Discussion.
None.
Clerk? Roll
Mr.
call.
Warden,
Aye.
Mr. Simonis,
Aye.
Mr. Johnson,
Aye.
Mr. Hulbert,
No,
Mr. Lumsden.
Aye.
Resolution 9.2, approving the camera key, door, and badge policy.
so moved.
Second.
Discussion.
None.
No, I have none.
Mr. Warden,
Aye.
Mr. Simonis,
Aye.
Mr. Johnson,
Aye.
Mr. Hulbert,
Aye,
Mr. Lumsden.
Aye.
9.3, authorizing RFP issuance.
So moved.
second,
Discussion.
just to,
The umbrella.
make sure that we get the insurance, for the umbrella.
Yeah. I wrote that down.
And I'm not expecting us to review and approve that, just to get that from the insurance company so that we know what's gonna be in the RFP. Is that reasonable to everybody? Right?
That's reasonable.
Yes.
Yep.
And I'll bring that correspondence back for the
Yep.
next meeting.
Yep.
See what the recommendation is.
Yeah, I mean,
Yep.
whatever he emails you on what
Yep.
it is, forward that to the board and
Yep.
then the RFPs to match it.
As long as it's reasonable.
Any
And
more
the-
discussion?
And we'll issue an addendum you know, if there's any changes, of course, from that. Or if you guys at the next meeting go, seems low, we want it higher.
Okay,
Fair enough.
Okay,
very good.
roll call, please, sir.
Mr. Warden?
Aye.
Mr. Simonis?
Aye.
Mr. Johnson?
Aye.
Mr. Hulbert?
Aye.
Mr. Lumsden?
Aye.
9.4, appointing interim head of code and
So moved.
Second, discussion.
None.
None.
Mr. Warden?
Aye. We have to, this is just for the appointment, but I didn't see anything with,
I had sent this afternoon, like 3 o'clock, Miss Diane sent me an email that I forwarded all you of her request, because you had asked about what she wanted pay-wise. And that's, I had asked her that Thursday. I was out Monday, yesterday, and today she sent me that. I think it was like 3 o'clock. You can look at your emails. 2 o'clock. She sent me what she's asking for.
Can we do that retroactively if we're not doing it tonight?
yes.
Okay. I just don't want it to go, get lost. Okay.
Yep.
and then- Okay, and I'll look at it in the email and see that.
I didn't get it till,
no, I understand, but
Yeah.
so I could still vote. We're gonna talk about this, what she said.
I haven't seen it, so yeah, you can talk about it, of course.
We're just making her interim. Okay, yeah, go ahead, go with the vote. I said aye.
Mr. Simonis?
Aye.
Mr. Johnson?
Aye.
Mr. Hulbert?
Aye.
Mr. Lumsden?
aye.
9.5, resolution authorizing increase in rate for treatment plant operators.
So moved.
Second?
Discussion.
I have none.
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 Clerk?
Mr. Warden?
Aye.
Mr. Simonis?
Aye.
Mr. Johnson?
Aye.
Mr. Hulbert?
Aye.
Mr. Lumsden?
Aye.
9.6, authorizing budget line item adjustments.
So moved.
So,
Yep.
second,
Discussion.
in the process for this, are we extrapolating out, just to cover the next month, or is this to get through the end of the year?
When I talked with Lori and Darren and Greg about what we should be doing, it's try to think what you need through the rest of the year. That was the conversation. I don't know what this actually does.
Okay. Just if that could be answered, that's all. It doesn't need to be tonight. I just want to make
Yep.
sure that we're being proactive. We do budget adjustments once instead of 3 times. Okay.
Mr. Warden?
Aye.
Mr. Simonis?
No.
Mr. Johnson?
Aye.
Mr. Hulbert?
Aye.
Mr. Lumsden?
Aye.
9.7, authorizing the re-levy for delinquent water and sewer charges.
So moved.
Second.
Discussion.
None.
None.
Mr. Warden?
Aye.
Mr. Simonis?
Aye.
Mr. Johnson?
Aye.
Mr. Hulbert?
Aye.
Mr. Lumsden?
Aye.
9.8, I'm not sure if you want to have an executive session to discuss this before taking action, or if you are all comfortable taking action on this right now.
I can't take action on it unless we, but, you guys,
So can we hold it? Go into executive session? You gonna make a motion to do that, Kevin?
sure. Make a motion to go into executive session
For resolution
with the
number,
lawyer.
Well, regarding matters relating to the employment of a particular employee.
Yes.
Second.
Will that particular employee be joining us?
You guys can certainly invite him if you want to.
I,
make the provision.
yeah, I don't see any reason why he's not.
Well, we can bring him in, whatever you guys wanna do. What do you wanna do?
Do you want to invite him in, Kevin?
Yeah, I want to invite him in. Do we have a discussion before? or-
Yeah, you guys can, we can talk before, and then you can invite him
Then
in.
we're just making it in the motion to bring him
Yes,
out. We'll
absolutely.
come get him.
Okay.
Amend my motion to bring in
Okay.
Who seconded it?
Mr. Johnson?
Mr. Johnson, you amend it?
I amend my motion.
Okay.
Oh. A second, I amend my second.
Well, we haven't gotten there yet.
We're even ahead of our, camp. Aye. Aye. Just try to move along. No, get this done before 8.
Walk faster. No bathroom breaks.
I'll make a motion to go back into executive session.
Do you want to do your future board topics first, or?
Yeah, but I thought Gene was waiting for us.
No, he went to the bathroom.
Sorry, I'll take that back.
What are we doing about this resolution?
You gotta do the resolution. 9.7. Nate, you wanna reread that?
9.7, extending the probationary service term of Gregory Burden.
So moved.
Can I ask a question? Can you put up to that amount, not making that a set amount?
It's not a set amount, right? Because we can adjust that, Nate, right?
Yeah, you can always
Just as, yeah,
shorten it.
right, just for what we talked about.
Good?
Did you make the motion?
Yeah, there was no second.
I second.
Any more discussion?
None.
Mr. Warden?
Aye.
Mr. Simonis?
Aye.
Mr. Jensen?
Aye.
We're voting on, 9 resolution for Mr. Burden.
Mr. Albert?
Aye.
Mr. Lumpson?
Aye. Want to do future topics, gentlemen? We need to get, Darren Kroc asked me to get Carmichael Road on a discussion on a future agenda, and we have Greg Burden's rate increase and all that. Anyone got anything else?
No, I just got a question. When will you have the document prepared?
For both? For both. When is our next scheduled meeting? The second?
First.
First of October.
We have 3 in October.
Yep.
Let's do the second one if you don't mind.
The 15th.
On the first?
I don't mind, I just want to.
So it'll
15th.
get bumped. Okay.
The documentation for your item.
Carmichael,
Carmichael.
you be ready for the first?
You're good for the first?
Okay. 15?
15 minutes probably max. Open quicker.
Yep,
That's fine, I just know I'm open.
okay. Yep. Good with that? Anything else on the next meeting?
We gotta do Diane's stipend,
Diane's,
or
yep,
whatever.
Yep, stipend. Yep,
And do we have to discuss this healthcare thing?
yes. Well, we should sometime, maybe on the second one in October.
I'm just bringing
Yep,
topics up.
yep, yep.
Can I put on the agenda without being here wastewater treatment plant position stuff? I can submit that, you guys can review it, saying where we're at.
Because he's gonna be out of town. And the next one on the first guy?
Yes, because the Indeed ad will be over with by then.
Yeah.
You'll know what you got for applications.
Yep.
You okay with that?
Yes.
Okay?
You'll just give us information on if we need to
Yeah,
prolong it or whatever.
yeah. If we don't get any applications, it's gonna be pretty simple.
Well, no, that's a different,
That's not what I
Different.
mean.
Yeah.
If you want to extend it or not.
Anything else? Gentlemen?
The rezone applications?
Pardon?
The rezone applications?
But if they're not complete,
Alex has not reviewed the Bodek one, which just came in, so Alex needs to review and recommend whether it's complete or not. Boland, I don't know if you're done with that.
Boland, I reviewed a few times with him, and he came back around based on my last round of comments to make it complete, which he did, but he gave it to us late. So I didn't have it for today's agenda. So Boland, I believe, is all set for the first. Adam was checking on his feet. Is the only thing that we realized. I don't know that anybody got a check.
He says he can get that to me Tuesday. He's out of town.
Yeah, we didn't realize that no one in planning or anywhere had seen a check. So Boda gave one, and we were discussing where those things get applied and realized we didn't have a Boland check. So it's okay that he's not here today because he hadn't paid yet.
Yeah, so Bodek not ready, Boland ready.
Okay.
And Chris and I are scheduling to talk, though, the same way that I did with Boland.
Okay. Anything else, gentlemen, for agenda?
we didn't decide if we're going on
Boland's was the first.
Oh,
I
Boland's
thought
the
you were
first,
saying
so-
it's ready for the next meeting.
Correct. As long as his check comes in.
Right, well, right here, right now, no, it's not, check's not in, we don't have it, I don't
Well,
wanna put it on the.
if it comes in by next Thursday, I'm gonna submit it with my stuff
Well,
on
he said
Thursday.
you, okay, okay.
So we're setting stuff for the next agenda. I don't wanna put it on the next agenda if it's outstanding.
Right. Okay. He might be ready for the next one. huh?
Earliest is the 15th for my.
Okay.
Okay.
But it's also an issue with the discussion on, on the moratorium.
Moratorium, yep.
So
Yep.
I don't think we should be accepting applications if we're talking about a moratorium.
But the applicant still has a right under the old comprehensive plan to submit it to us. Doesn't mean we have
Doesn't mean you take
to
the
approve
vote.
it or change the zoning, but they have a right to submit it. Why would they not?
It's intent in the spirit of what we're talking about doing, and that's the whole issue.
I'm just
But I don't know how, I don't know how we
How do you
not
tell them
accept
you
it,
can't?
right.
Well, I'm not saying
Well, yeah, how do you tell them not to apply, that it's
Yeah.
complete, but
I think it has to be on the agenda, and then we have to accept it if we
or
want,
not accept it.
or not accept it. Correct? I
That's
thought
what I'm
that's how it
thinking,
went.
but-
After he
Right, you
reviewed
got
it.
an answer to this
yeah,
legally?
Yeah, I'm just looking at your procedure for zoning change for a planned development district. Applicant submits a copy of the development plan to the town board refers it to the planning board 10 days prior to the planning board next scheduled meeting. Referral will be made prior to the date of the public hearing. Planning board shall discuss, prepare recommendations within 45 days of receipt of the application and development plan. Planning board transmits its recommendation to the town board within 45 days after that. Public notice shall be given in a public hearing held by the town board on the proposed change of zone, and then the town board makes its decision. So, legislatively, you guys have said this is the process. I mean, ultimately, the final decision will be the town board, and it's a legislative decision. You can always just deny it. So then the question would be, since you ultimately can just deny it, can you shorten and just cut off the process under your local law by saying, well, we're never even gonna bother considering this, we're not gonna do this process? Because why do a bunch of things that is just gonna end up in a no?
I think until we actually pass the moratorium, we function normally.
Or at least have a conversation.
well, the only issue I see there, that if we accept his application check, and to Gene's point, our intent, we start going down the road and does not permit it in time, the moratorium suspends him, and he has to start all over again. Where if he's tabled now, right, I mean, we're under no obligation to kind of
You
revitalize
can
that.
put them on a future agenda after your moratorium.
I see both sides of it. I just think that, he's got to know what the board's intention is and timeline,
Right.
that
So courtesy call?
Well,
Let
that's
them
what
know.
I'm saying.
and
Why
if he
would he
wants to put-
submit his check?
if he wants to do that, to go through it,
I know, but I'm saying
Yeah.
if that's the board's intent and he's not gonna be done in time,
he
I
can't. He can't
I don't
be.
see how it can be either.
No.
Because if we vote to take that moratorium on the 27th, he's not anywhere close to that. But
Right.
his application was received by the town, and we accepted his application fee. To me, that's lost, and that's a little disingenuous.
Yeah.
Tell him.
Yeah.
Tell him if he wants to take a chance or not.
I think,
I mean,
right?
You told him a month ago to submit his application.
We did.
We did,
He
but
was
we
here
didn't,
and you directed him that way. So it's,
we did, and that was prior to any moratorium discussion.
Yeah.
I mean, we didn't even bring the topic up when he was here.
I'm sure in many towns, no matter where a moratorium comes in, there's always this,
Somebody's usually in the
someone's
process.
I, Mike,
usually in this circle.
I get that, but that just
Yeah,
isn't
I know.
being a good neighbor at all.
Yeah, so courtesy call to them. Let them make their choice.
Yeah, right, I think it has to be his call. I mean,
So
if
do
he's
I.
watching tonight, he's gonna know it, but
Yeah.
it's unlikely he is,
Right.
especially if he's out.
And any application that we stop, if there's a fee associated with that, I don't know why that wouldn't go back to the applicant. When it's
But
stopped.
you,
That's, okay, and I'm fine with that,
they didn't do
if
that
that's
with
the
Bodak,
case.
did they? I thought you kept his fee.
I don't
We
know.
didn't stop. We didn't stop the last time.
Okay.
Yeah, we held all the solar fees on the solar one, and they just opened up again when the moratorium stopped.
No, I thought you guys did that with the Bodak, where he put his money in
No,
or
but
something.
that
That was a different reason.
Oh, I
that was a
wasn't
different
out. Okay.
condition.
Yep.
Fine, I was out of it.
He was incomplete.
Yeah.
He was incomplete.
So for
Got it.
what Alex is referring to though is, I mean, a moratorium puts up the pause button on applications. So they will resume once the moratorium is lifted.
Oh.
So if somebody's applied and given money, then they don't need to pay again once the moratorium comes up.
But they
'cause-
don't need to start the application process.
Yeah, they don't
again.
need to start it again
But
because
what-
they're in the middle of it.
What if something changed that would require them to modify the application?
Well, this is what I referenced earlier about you might say the moratorium might need to continue on specific things. Because if the comp plan changes, that won't change that doesn't change your law, that doesn't change the application process. They would continue with that, and then the environmental review would have to take into account the differences between whether the plan is in violation of the comp plan or not for purposes of conformity. But it wouldn't change the application process and even the review criteria overall. Now, like the last time when you did the solar moratorium, you did require, a whole new solar law. So the applicant did have to go back, revise their plans to bring it in alignment with the new solar law from '23. But we considered that a continuation of the existing application. They didn't need to submit a new application fee.
We even changed their escrow amount and asked them for another $7,500 in escrow, and they submitted that, but they kept moving. Right.
I just want to be fair and respectful to the applicants. And if that's giving them heads up notice that we're having a
So
discussion.
can either Alex or Nate make a call to these applicants, current applicants?
I'm in favor of that.
Yeah, I mean, Alex, put it on Alex, he's been in touch with them.
But you've been talking to him anyways.
Right, that's,
I could tell them to look back at,
yep,
820.
yep,
You
okay.
know, until everything's in with the fee and everything else.
It's
you
their
know,
choice, yep.
Looks like the 15th is the earliest that you can push it through, but we're gonna be meeting soon after that.
Okay,
And I don't know if our town needs to hold on to a check for 12 months.
no. No.
Not sure they're valid at that point, if it's held there
Yeah.
versus
Probably not.
cashed.
Check is not valid after that long.
Either way.
Yep.
Okay.
Anything else?
I have the policy manual discussion. I kind of want to put that on Jody's plate.
Because, that's good, because she's got a couple things she'd like changed.
So the stuff that I've got compiled, I can send her.
Send her. You guys are all right with that? Yeah?
Yes.
Get it to her.
So I'll just
She's
copy you,
working on
I'll
stuff
copy you
first.
guys on what I send her for the policies that we have. and
I'm fine with that.
And then we
Yep.
can work with her just to kind of feed her and stuff,
Yep.
but,
Because she's got some suggestions.
well, I'm not talking about suggestions, I'm talking about compiling the manual for the policies that
Yes.
exist as
Yeah.
they are.
But that's gonna help the conversation.
Right, but that's a different issue on developing policy.
Yeah?
Okay, all right.
Is that for the next meeting?
No,
Just-
I'll just keep, I'll just
Okay.
copy the board and all the policies.
To be
She'll be
announced.
compiling it and then
That's a
updating it.
TBD.
Okay?
Yep.
We got everything? I'm gonna ask, huh?
The few,
Before we go in, someone's going into executive session again?
do we have any movement or do we need any? on the
I didn't hear you.
On the feasibility study.
What?
the feasibility study.
Yeah. When do you want to do that?
That we have to put together the RFP for that. That has not been started at all by anybody.
No.
Okay. All right, let me do some research on that, and I'll update you guys next week on
That'd be
what I-
great.
what I can, just as an update.
Yeah.
Okay. All right, I'm all set, thanks.
Can I go to the public?
Yep.
Mr. Cock, you're the only ones here. Would you like to speak?
10:21, we have the special meeting for the budget.
Yes.
I'm just trying to figure out the schedule time. I can't do 2 o'clock. Because Joy's gonna be working till 3, we work till 3. So if I can get after 3 o'clock, just so that she can move to, go through that.
So instead of putting you first, you want to be moved down the ladder? Okay.
I can be here, but I can't, she can't.
Yeah,
be
but
here. Do I need her?
you guys have a problem with that? We just put you first, but,
I can't go to.
well, you'll go second then, that's all right. Okay. Anything else? All right.
That's a budget meeting, am I at that also, or is that,
Yep.
I've never heard about it. What are you guys inviting me to?
Budget meeting,
What day, what time?
21st, 2 o'clock.
Okay.
October
Great,
21st, 2 PM, but you're not at 2 PM, somebody's got to tell me
Yeah.
what time to come.
Well, he can go first now because Mr. Cock would like to go afterwards, so we can do these two vice first. Huh? Well, no, Greg.
Gene said I gotta be here all night. If he backs out, that means I'm gonna be here all night.
Okay,
Anytime after 3 is fine for me, it doesn't have to be right
it's
after.
fine, it's fine. If, it's fine.
Yeah,
10:21, 2 PM.
I think you guys can work that out.
Yes. All right, who's making a motion to what? One of you guys said executive session. You?
Yep, so this was an executive session to discuss matters relating to the employment of individuals within the town. And then I guess I'd ask the board if you'd include in that motion, possibly including Darren to come into the conversation at some point. I'm not sure if he wants to, or if you will want him in at some point, but just to make that in the motion
I'll
or
make
not.
a motion to go into what you said and possibly inviting Mr. Cock in. All in favor?
Aye.
Aye.
I'm a no.
Well, you gotta walk faster. Take it back. You were behind the chair. I didn't even see you. I thought everyone. He's real old. Ended up having a life. Who made the motion?